Kinalakta. Papurublume. I tong me kaptigut, koya giptigit. Inuduti kapting niglo. I talk pakaptigut, koya giptigit. Umatiptigit. Tap quarter Margali activital baniki katawit. Tamaita. Unagima katit. Iumakai niglo. I toma katit. Hilatu. Apakput. Apikiptigit. Ikaw tuwi na huwag mata, kibgak tuwi blutik, no nakatimingnik, ihuma liukutik kainik, ay to kumakatin, umatiptingnis, kingaw tigi awnap ko. Atane, ilbituak, ay tuwi nakabit, inudutik kaptingnik, kanoklaka, humilaka, kuya gigiptigit, ublumiu kalawak, ay tokpang migaptiwit. God, our Heavenly Father, we thank you for this day. We thank you for your many blessings. We thank you that we're able to be here today, to be of some service to the people here in the Northwest Territories, especially our leaders. We pray for them, Lord, that you'll give them wisdom, grant them wisdom, and that they'll make decisions that will enhance the people they represent. Thank you, Jesus, for all that you've done and for all that you're about to do. Heavenly Father, there is none like you. We appreciate all your goodness towards us, even for today, the blessings. We ask all these things in Jesus' name. Amen.
Please be seated. I'd like to thank Elder Joe Otokiak for the opening prayer, our reflections. Minister statements. Minister from ECE. Just joking. ITI.
Mr. Speaker, happy Small Business Week. Let us recognize and celebrate entrepreneurs who drive our economy and enrich our communities. Small businesses are the backbone of the Northwest Territories. Whether it is recent graduates and newcomers bringing fresh ideas and technologies, Indigenous people keeping cultural traditions strong, or longtime Northerners sharing decades of experience, these businesses reflect the values, cultures, and aspirations of the people who live here. Mr. Speaker, small businesses are woven into the fabric of everyday life in the North. They fix our furnaces, fly us to communities, and help us navigate our taxes. They provide health services that support elders, and they create spaces for fashion, food, and entertainment that reflect the diverse cultures and tastes found in the Northwest Territories. Their work touches every corner of our lives, from the essentials to the extraordinary. The impact of small businesses goes far beyond economics. They create jobs, yes, but they also create identity. They bring innovation to our doorstep and build relationships that strengthen the social fabric of communities and regions. Mr. Speaker, small businesses in the Northwest Territories have shown remarkable resilience. They have adapted to changing markets, embraced new technologies, and continued to serve their communities through challenging times. Their creativity and determination are a testament to the strength of Northerners. As Minister of Industry, Tourism and Investment, I am proud to oversee programs that help people overcome the costs of starting up, offer advice and guidance on growing their businesses, and provide support during crises that threaten their survival. To ground our commitments in tangible action, the Government of the Northwest Territories offers several programs to support small businesses. These include ITI's Support for Entrepreneurs and Economic Development Program, which provides funding for startups and expansions, loans, investments, and business services offered through Prosper NWT, where we have strategically increased limits for eligible loans from $2 million to $5 million, and support for workforce development for employers that help them continue to grow the NWT's skilled workforce over with education, culture, and employment. These initiatives help entrepreneurs move forward, whether it's accessing capital, finding mentorship, or navigating the challenges of building a business. We are also helping businesses become future-ready with new technologies that build long-term resilience. This week, Prosper NWT is partnering with the Yellowknife Chamber of Commerce to offer a cybersecurity session for small businesses. Other upcoming workshops take a deeper look at cybersecurity and explore the growing potential of AI. Mr. Speaker, I encourage all residents to take a moment this week to think about the goods and services they rely on every day and to recognize the local businesses that make it all possible. Whether it's a warm meal, a repaired vehicle, a helping hand, or a funded sports team, small businesses are there for us. Across the territory, communities are hosting events that showcase the creativity, resilience, and diversity of entrepreneurs. These celebrations are not just about business, they're about community, connection, and the everyday impact that small businesses have on all of our lives. Small businesses are here for us. Let us be here for them. I challenge all of my colleagues to support a new-to-them business in the NWT this week in celebration of Small Business Week. Thank you, Mr. Speaker.
Thank you, Minister ITI. Colleagues, before we go on to the next minister's statement, I would like to recognize a couple people up in our gallery. Lillian Elias and her grandson, Charlie Cockney. Welcome to the Assembly, and you get to stand up there instead of translate for us, so welcome back here. Now I'll follow the script properly. I will turn to the minister's statement and have the Minister for Health and Social Services to start. Should have been.
Thank you, Mr. Speaker. Mr. Speaker, health systems across Canada are facing serious and complex challenges. The Northwest Territories is not alone in this. Every province and territory is working to respond to the growing impacts of addictions, mental health needs, workforce shortages, and service gaps. That is why collaboration with other Canadian jurisdictions is essential. I recently attended the inaugural meeting of the provincial and territorial ministers responsible for mental health, addiction, and recovery, held in Alberta. This was an important opportunity to share experience, learn from one another, and strengthen our relationships across jurisdictions. Ministers discussed the changing drug landscape, the urgent need to build system capacity, close service gaps, and support individuals with serious substance use and mental health issues. We also committed to continue working in partnership with Indigenous governments and Indigenous-led organizations to advocate for culturally appropriate services and federal funding that reflects the realities in our communities. Mr. Speaker, Alberta has taken a whole-of-government approach to addiction recovery. Their work presents real opportunities to learn and explore how similar approaches can benefit residents in the Northwest Territories. The Department of Health and Social Services is reviewing what was shared with us, and we plan to continue conversations with Alberta on how we can continue to work together. Mr. Speaker, beyond mental health and addictions, we know that there are benefits to closer collaboration with Alberta. Just last month, the Northwest Territories and Social Services Authority implemented new diagnostic imaging technology that allows physicians in the Northwest Territory to instantly share CT scans, ultrasounds, X-rays with Alberta Health Services through a secure QR code system. This system is currently used in urgent cases such as stroke and trauma, where timely access is needed to imaging is critical. It supports faster consultation between jurisdictions, helping physicians make timely, informed decisions about patient care and transfers. It's a clear example of how interjurisdictional partnerships can improve outcomes for residents and strengthen our service model. The Department of Health and Social Services has been working towards formalizing several existing arrangements and partnerships with Alberta Health Services through a master service agreement. I will provide an update on our significant progress on this work later in this sitting. The department is also working towards one with BC government and Atro-Dene-Co senior officials about possible reciprocity agreements to support NWT residents to access care closer to home. Mr. Speaker, I participated in the federal, provincial, territorial health minister meetings last week in Calgary. Workforce challenges, mental health and substance use, and the importance of sustainable federal funding were key topics of this discussion amongst ministers. The Northwest Territories actively contributes to the National Committee on Health Workforce, which is focused on improving how international educated health professionals are integrated into provincial and territorial health systems. The committee is also working to streamline registration and licensing process to enhance labour mobility for physicians and nurses across Canada. At last week's meetings, I continue to advocate for the importance of sustainable and predictable funding that is also flexible enough to meet the unique needs of the Northwest Territories residents. With some bilateral agreements with Health Canada set to expire at the end of this fiscal year and next, and no current federal commitment for renewed funding, I join my ministerial colleagues in advocating to the Minister of Health Canada for a path forward that takes into account the unique circumstances of each jurisdiction. I also emphasized our readiness to collaborate further to ensure a fair and sustainable approach to this sunsetting funding. Mr. Speaker, our participation in the national table is long-standing. Today I've highlighted a few recent examples, and I want to emphasize that the Department of Health and Social Services continues to actively engage in federal, provincial, territorial discussions on a wide range of topics, including seniors, persons with disabilities, fetal alcohol spectrum disorder, medical assistance in dying, nursing, emergency management, and patient safety. These forums help us stay informed on best practices, share knowledge, and identify opportunities for collaboration and partnership. Our collaboration with other governments help us respond to the daily challenges faced by Northwest Territories residents and our health and social services system. We remain focused and committed to building a stronger, more responsive system, one that reflects the needs of Northerners and supports healthy people and communities. Thank you, Mr. Speaker.
Thank you, Minister of Health and Social Services. Minister statement. Minister of Finance.
Mr. Speaker, as Canada's digital landscape continues to evolve, so too do the threats to critical infrastructure, government services, and personal information. Meeting these challenges requires a united approach. Cybersecurity is a shared responsibility, and our collective efforts are key to building a more secure future. On September 22nd and 23rd, I had the honour of joining my colleagues at the Federal Provincial Territorial Ministers Symposium on Digital Trust and Cybersecurity in Kananaskis, Alberta. At this forum, we collectively recognized the increasing complexity of cyber threats and the urgent need for coordinated action. And together, all participating jurisdictions signed the Canadian Cybersecurity Collaboration Agreement, a landmark commitment to work together to protect Canadians and the information systems we rely on for public services. This agreement enables governments to share real-time threat intelligence, cybersecurity tools, and technical expertise. It also establishes mechanisms for mutual assistance and joint response to cyber incidents, helping each other prevent and mitigate the impact of cyber attacks on our critical infrastructure. Mr. Speaker, this agreement is more than a document. It is a foundation for a pan-Canadian cybersecurity community. It reflects our shared commitment to safeguarding public services, supporting innovation, and ensuring the resilience of our systems and services in the face of evolving threats. For the Northwest Territories, this collaboration is especially important. Our unique geographic, infrastructure, and resource challenges require greater collaboration, and through this agreement, we gain access to national expertise and resources that strengthen our local capacity. I am proud the Northwest Territories is a full signatory to this agreement. We will continue to work with our partners to build a secure, inclusive, and resilient digital future for the residents of the Northwest Territories. Thank you, Mr. Speaker.
Thank you, Minister of Finance. Member statements. Minister statements. Minister statements. Member statements. Member for Yellowknife North.
You said North, right? Thank you, Mr. Speaker. Mr. Speaker, when I say the word economy, most people in the NDP think we're talking about mining. Or some think economy is about where the money comes from. So here, that's basically the government and how it spreads money and jobs around. But the word economy can also mean how wisely we manage the resources we have. It comes from a Greek word that means management of a household. I want us to get our territorial house in order and take better care of what we have. The way things seem to have always worked up here since colonial governments were established is that now and then Ottawa throws a bunch of money our way for big infrastructure projects, and then once it's built, Ottawa moves on. No one figures out how much money will be needed for ongoing maintenance and repairs, or who will pay when it needs to be replaced? That's how we've ended up with all these public housing units built by the feds in the 70s and 80s, which are now falling apart, and a $300 million housing deficit. That's how we've ended up with all this aging power infrastructure that ratepayers can't afford to pay to replace, and highways in terrible shape. Think of a household living handout to handout. You're always in crisis instead of taking careful steps to prevent things from breaking down. Instead of steadily working hard to take care of things within your control, you're more likely to wait passively for the day that you win the lottery, meanwhile getting poorer and further into debt. As a territory, we spend a lot of time either begging the feds for more handouts or spinning the roulette wheel for the next motherlode mine that's supposed to make the cash rain down again. Maybe some of us believe there's no other way. Most dangerous is when we believe there's no point in even planning ahead, that either God or the federal government or the global mining deities will always swoop in and save us. Mr. Speaker, I don't have the secret path that will make us all wealthy, but we can at least save money and take back more control over our destiny. Before charging ahead to build more new things, we need to think carefully about how much those new things will cost to maintain and replace, and whether we'd be better off focusing our resources on taking care of what we've got. Thank you, Mr. Speaker.
Thank you, member from Yellowknife North. Member statements. Member from Yellowknife Centre.
Thank you, Mr. Speaker. Mr. Speaker, I'm going to talk about a very serious subject here right now. If you didn't know, I'm going to tell you, there was a fire on the encampment next to the museum, Mr. Speaker. This is a very serious matter, even coming from me, Mr. Speaker. I'm trying to remain the right approach because it's frustrating. Yesterday, I was raising the issue. I wanted, actually, Mr. Speaker, to even have an emergency debate on this particular issue, but our rules won't allow us this because I didn't have an hour's notice to give notice to this particular problem. Mr. Speaker, in absence of that, I want to start off by first saying I hope no one was hurt, sincerely, and I deeply mean that. I'm thankful for YKFD for being there on site. I'm thankful for MED for supporting them and the people following the instructions. And I certainly say this should give this darn house pause right now to say we need to do something and step up about this encampment problem. Mr. Speaker, the fatigue is real. It's not just me. It's not the citizens of Yellowknife. It's across the world, Mr. Speaker. Mr. Speaker, with no policy, inconsistent application, lack of support here, support there, it can put real lives in real danger. This is not a joke, Mr. Speaker. A serious urgency is before us, and I'm not sure how much louder I can be or how much I can say to draw this attention, Mr. Speaker. Mr. Speaker, yesterday I talked about the fact that we don't have a clear policy to follow a process. Mr. Speaker, I understand that, but no offense, I could come up with a policy, steal the one, or technically liberate the one from Toronto or Vancouver or something like that. We could have one written over the weekend, in place by Monday, and say, with a little footnote on the bottom saying, we're doing something and we're going to revisit this with our community partners to make sure we get it right. So in other words, show some action. Waiting to spring 2026 is incredibly unacceptable. And I challenge the minister, respectfully of course, but I challenge the minister to say, we can do this. And I know she can do this. She's got a smart policy shop over there. They could come up with something, and it doesn't have to be complicated, Mr. Speaker. Because look, when I snuck out between the break late this morning, I could see the pile of propane tanks there. I saw the stovepipe from the tent just barreling smoke. I thought there was an agreement from what I heard that they weren't supposed to have any fires. Mr. Speaker, my fear is we've already had one encampment burn on the other side of the Legislative Assembly. We've had the second encampment burn that I'm aware of next to the museum. If that fire jumped, our territorial treasure would have been lost, Mr. Speaker, and who knows what else could have happened. The bottom line is we have a third encampment that I'm referring to downtown. Let's hope nothing serious happens. We need a policy, security, safety, and help for everyone. We can do it today. Yes, you can, Minister.
Thank you, member from Yellowknife North. Member statements. Member from Great Slave.
I don't know how you follow that. Thank you, Mr. Speaker. As the Minister knows, I have a non-binary constituent who has shared their experience in the media with the public health system, as current guidelines cannot accommodate them in a way that would address their gender-affirming care needs in a timely and safe way. This means that they are seeking life-affirming treatment at their own expense in a jurisdiction that is not Alberta. This also means that the 2S LGBTQIA+ community in Yellowknife raised nearly 2/3 of their surgery costs at a fundraising event 2 weeks ago. Although this is heartwarming, it should still not be normalized. Mr. Speaker, I'm not going to debate with the minister over my constituents' needs. We have done so over many months, and I have been told that this is how the guidelines for gender-affirming care are currently applied. To the minister's credit, she has sat down with her staff and listened to the Northern Mosaic Network speak to myriad systemic barriers in the NWT for trans and gender diverse folks. As a result of these conversations, there is a renewed connection, and I am hopeful for positive outcomes of a working group convening in the new year to examine these guidelines together. The network has also conducted a research project on their community's feedback on healthcare services with the University of Manitoba, with a forthcoming report expected in November that I know the minister will take the time to read and discuss with her staff. Mr. Speaker, I know that as of right now, the GNWT will not pay for gender-affirming procedures at private clinics when there are public options available. This was also an issue in the Yukon. But the Yukon chose to make regulatory changes in 2022, and now they are the most progressive and inclusive jurisdiction in all of Canada for folks seeking gender-affirming care. Mr. Speaker, I know the minister is willing to have her staff research and review the Yukon's experience and find lessons learned that are applicable to the NWT, so that we can appropriately support folks needing gender-affirming care. Let me be crystal clear. This is life-saving care. We need to avoid the endless cycle of crowdsourcing funding for what should be publicly available. I will have questions at the appropriate time.
Thank you, member from Great Slave. Member statements. Member from the Sawtooth.
Thank you, Mr. Speaker. Mr. Speaker, the week prior, I participated in the Mackenzie Valley Highway promotional reception in Ottawa, which was sponsored by the Department of Infrastructure and the Sawtooth Secretariat Incorporated. The event was well attended by our Premier, Cabinet, members of the Council of Leaders, Western Arctic MP Minister, Alti, federal ministers, and designated staff, and other distinguished guests. The event was well attended and distinguished by its unique focus on infrastructure needs, the federal government's directive on critical minerals, and the advancement of nation-building projects. Indigenous governments are included to participate in ownership, equity positions, partnerships. These are project fundamentals in previous. Mr. Speaker, in previous on history, the Fort Good Hope joint venture of 1987, which was the first of its kind prior to the Sahtu land claim settlement. Industry and Indigenous community equity participation, critical to the meaningful of that JV, is further unique in its groundbreaking economic pathway. This venture included co-management and administrative structure. One could argue that Bill C-5 of today's pertains to the expedited regulatory approval process through a then direct rights issuance. Mr. Speaker, Sahtu Incorporated has made substantial progress recently. Number one, a motion supporting a private sector partnership. Mr. Speaker, these discussions included an MVH project financial model. We now have project scope, budget, and schedule. Without further delays or extensions, the Sahtu region are of the said statement by our government. Construction of the Mackenzie Valley Highway begins 2027. Similarly, this schedule was discussed and tabled during the SSI GNWT MOU Steering Committee. I invite GNWT to this partnership with the federal government expectations of one.
Member from the Sawtooth, your time is up. Member statements. Member from Mackenzie Delta.
Thank you, Mr. Speaker. Today I would like to address the closures of the community learning centres and the infrastructures that remain within these communities. The sudden closures of the community learning centres have had a negative impact on the employees, the communities as a whole, and especially the potential students who are trying to better themselves for a secure future. But today I would like to inquire about the infrastructure within most, if not all, our smaller communities. Mr. Speaker, the Department of Education, Culture and Employment has put out 2 community organizations that, if they had a plan for the infrastructures, they could submit a letter of interest. I had 2 communities within the Mackenzie Delta riding that expressed interest for the use of these buildings. I do not know how many organizations within the affected communities expressed interest for the use of these buildings. It is my hope that the department gave any interested communities, organizations, the opportunity to use these buildings for community capacity. Mr. Speaker, in my riding of the Mackenzie Delta, the interest spans from community health center to replace an aging infrastructure to utilizing the building for local government office, and also for the use of disbursement center for the Canada Food Bank program to benefit the community and its residents. These buildings could and should be used for the benefit of the affected communities and its residents. Mr. Speaker, in closing, it is my hope that each of the community organizations that express interest for the use of these buildings were given the opportunity or even had a chance to consult with the Minister of Education, Culture and Employment. Thank you, Mr. Speaker. I will have questions for the Minister of EC&E at the appropriate time.
Thank you, member from the Mackenzie Delta. Member statements. Member from the Decho.
Thank you, Mr. Speaker. Many small businesses and entrepreneurs in the Decho region are working hard to build resilient, community-driven economies. These businesses are the backbone of our communities, yet they continue to face significant challenges that require urgent attention and support from the Department of Industry, Tourism and Investment. The South Slave Region Economic Development Plan was tabled in this House in 2023, and it highlights many issues that continue to be prevalent in communities in the Decho riding. These include limited access to skilled workers, high cost of doing business, regulatory barriers, and the lack of infrastructure and housing. Small business in my riding struggle with many challenges, including access to capital, reliable internet, and affordable childcare, factors that directly impact their ability to grow and hire locally. Mr. Speaker, the plan emphasizes the need to foster an entrepreneurial culture and create environments that support business development. In the Decho, we have untapped potential in tourism, arts and culture, agriculture, and renewable energy, to name a few. But without targeted investment and support, these opportunities remain out of reach for many. The Department of Industry, Tourism and Investment must prioritize small business development in the Decho by expanding access to funding and programs under its mandate. We need to reduce regulatory burdens, improve infrastructure, and ensure that Indigenous governments and entrepreneurs are full partners in economic development. Mr. Speaker, our small businesses are not just economic drivers, they are community builders. It is our responsibility to give them the tools they need to thrive. So I'm happy to hear the Minister say, let us be there for them. I will have questions for the Minister of Industry, Tourism and Investment at the appropriate time. Merci, Mr. Speaker.
Thank you, member from the Decho. Member statements. Member from Range Lake.
Mr. Speaker, if our economy needs a red alert, well, our healthcare system, it needs a blue alert, Mr. Speaker. It's an exceptional state of affairs here in the north, where we need both a public administrator and a healthcare sustainability unit who've been working for a year with little to show for it, seemingly, at least to my constituents and patients and nurses and doctors in my riding. Extraordinary times have called for extraordinary measures, but while we continue to expect this government to take decisive action, the action they must take to connect Northerners to the health care they need, despite this, the minister the minister has taken these actions. We've had the premier take actions as well, but patients are still waiting for change. A core function of primary care is to connect Northerners to their appointments and ensure they have necessary lab work for their nurses and doctors. But we still can't seem to make this system work. My constituents continue to wait months for follow-up and can't even get into the clinic when they need an appointment. They can't secure lab tests, and it's not just my constituents. We've heard it just days ago in this House, Mr. Speaker. Instead, this inaction means frontline staff at Stanton's emergency room become their doctors, or their primary care doctors, and they have no other service to turn to. That's where people go. And without scheduled appointments, they often arrive in the ER in poorer health. This put patients at serious risk, as the ER's ability to provide care depends on fluctuating demand, and that demand is rising. Mr. Speaker, next year, the public administrator will provide an update on his work plan, but where have the updates been since then? We simply do not know what progress has been made on his 4 priorities. Some Northerners are even wondering where he has been public administrating from, because they don't see very much of him, Mr. Speaker. Meanwhile, frontline staff continue to tell us the same thing. To deliver the care Northerners need, we must recruit more frontline staff. Mr. Speaker, the healthcare crisis is still ongoing. One of the things we have seen improved that we can point to is the doctor shift bidding scheme that took place to keep the ERs open. Turns out, if you pay doctors more, they show up for your healthcare system. Mr. Speaker, the solution's already there. We don't need any more studies. We don't need any more action plans. We need to pay our healthcare professionals more to keep them providing the care that Northerners need. Thank you, Mr. Speaker.
Thank you. Member from Range Lake. Member statements. Member from Moultrie.
Thank you, Mr. Speaker. Breaking the cycle of dependency on income assistance. Today, I want to talk about a troubling issue facing many residents in our communities, the unintended consequences of the JNWT Income Assistance Program. Mr. Speaker, the reality is that income assistance, while essential for many, can sometimes lead to unintended dependence rather than encouraging self-sufficient. While many individuals in these situations are eager to improve their circumstances, the current system often creates barriers to progress. When someone takes steps towards employment or education, they risk losing the support they depend on. This discourages initiative and creates a cycle where fear of losing benefits lead to inaction. This is also the same for the housing, ultimately reinforcing dependency. A review of income assistance beneficiaries in Klitschko region shows a marked increase. In 2021, there were 365 beneficiaries. 2022, 416 beneficiaries. And 2023, this number went up to 483 beneficiaries. These numbers show a growing reliance on this program. Now, with the threat of the closure of the diamond mine, most likely these numbers will increase. Mr. Speaker, I want to be clear. This is not a failure of the people. It is a failure of the system. Mr. Speaker, we must shift our approach so that income assistance recipients are motivated to transition off the program. As it stands today, the structure of the income assistance program discourages initiatives and punishes progress. Mr. Speaker, we cannot expect individuals to break free from dependency if we do not provide them with pathways to independence. We must reimagine and reshape the income assistance program to function as a bridge, not as a trap. Mr. Speaker, can I have unanimous consent to conclude my statement?
Thank you, Member from Moultrie. Member from Moultrie is seeking unanimous consent to conclude her statement. Seeing no nays, you may conclude your statement.
Mr. Speaker, we need to invest in community learning and redesign the income assistance program to reward progress, not penalize it. If we empower people with the tools to succeed, they will. Let's build a system that lifts people up, foster independence, and strengthen our communities. I will have questions for the Minister of Education at an appropriate time. Thank you.
Thank you, Member from Wolfley. Member statements. Member from Inuvik-Boot Lake.
Thank you, Mr. Speaker. Mr. Speaker, I'll speak a little today on the economy as well. Mr. Speaker, we're coming into our fall session, including our fall session going into winter, where we'll be getting into our budget negotiations again, and we've heard loud and clear from all my colleagues in this House, and both on Cabinet and both on the regular members, I'm sure, that we need infrastructure, we need programs, but what we need, Mr. Speaker, to do this, to accomplish this, is revenue, and revenue is what we don't have. I empathize with the Minister of Finance. I know her job must be super difficult, given the fact that she has to find ways to get this infrastructure built and get these programs certainly where they need to be for all our residents with a limited amount of funding. We have natural resources, Mr. Speaker. We have opportunities. What we need to do is think outside the box. We have, as I've said in this House many times, there's 19 trillion cubic feet of natural gas just waiting to be developed in the Beaufort Delta. There are other resources throughout the territories. We are, again, resource rich and cash poor. Mr. Speaker, I know we have an envoy office in Ottawa. I had an opportunity during the Council of Leaders to speak with the staff member down there, and I am certainly in full support of having that office there. I think there's a reason to have that office down there, but I think we need, as a government, to ensure that we're utilizing that space, that we're making sure that what that office is accomplishing our connection to the federal government and to continue those dialogues and that lobbying. Mr. Speaker, you hear, if you listen to the House of Commons, which some of us tune into, you've got a leader of the opposition, looking to discontinue production caps on oil, to look at the shipping bans. Our government and our country is again looking to resources to make sure that we are able to maintain the revenue we need to continue to grow. And if we continue to fight over the little revenue we have, it seems like, again, I've said it before, the only industry growing, Mr. Speaker, in our territory is the government. And that's fine if, with that growth, you have the revenue to offset it, and your services and your programs and your infrastructure is being increased because of that, Mr. Speaker. So I encourage again, I'll have questions for the Premier. We've talked before about the potential of setting up committees where regular members can be involved in their regions to look at kind of assisting with some of this lobby work on major projects. Mr. Speaker, I seek unanimous consent to continue my statement.
Thank you, Member from Inuvik-Boot Lake. The member from Inuvik-Boot Lake is seeking unanimous consent to conclude his statement. Seeing no nays, you may conclude your statement.
Thank you, Mr. Speaker. And again, I mean, there are certainly members that have experience in previous positions that have worked on lobby efforts or worked on specific projects in the regions with either with Indigenous governments or with other organizations. And I think it's time that, again, as part of our consensus government, we look at doing that. We look at whether it's the Mackenzie Valley Highway, whether it's the Slave Geological or other major projects that we're working on, that we do actually work as teams and ensure that we're utilizing the office we have in Ottawa, and that we are indeed lobbying on behalf of all residents. Thank you.
From Inuvik-Boot Lake. Member statements. Member from Toonaday-Welledy.
Mr. Speaker, yesterday I returned from Fort Smith, where I attended a service to bring baby Alma home to her mother at long last. I am pleased to inform the House that the work to repatriate her remains from the cemetery of Fort Resolution, where she passed away at residential school over 80 years ago, is now complete. The wishes of Alma's mother have been honored, and now they rest together. For Alma's family, we have restored fundamental human rights that have been denied to our communities for so long, that the right to lay our loved ones to rest according to our own wishes and traditions. That right must not be extended to families across the North. Not all families will want to repatriate the remains of their loved ones, but the important thing is that they have provided with that choice. These rights are clearly outlined in the United Nations Declaration of the Rights of Indigenous People, and the Truth and Reconciliation Commission calls on to act. But this work remains complex. Because so many of the laws were inherited from the federal government of Canada are hopelessly outdated. These outdated policies created many barriers along the way, but through all the frustrations, Alma's 80-year-old sister Delphine never lost hope. Her unwavering perseverance and the determination of the Deniquin First Nation was deeply inspiring. They helped me stand strong and stand by my community no matter what. At the end, with the Premier's support, we got on the right track just in time, and I thank him for his work. But there's so much work to do. One thing this process has shown me is that amending outdated laws isn't enough. We need clear new legislation to ensure families has this choice. I'm ready to get to work so the North can lead the country in meaningful actions of reconciliation. And later today, I will have questions for the Premier about how can we keep this momentum going. Thank you, Mr. Speaker.
Thank you, member from Trinidad-Willowdale. Member statements. Member from Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, the GNWT issued a press release today highlighting the release of the 2025 Northwest Territories Environmental Audit, celebrating notable progress over the past 5 years since the 2020 audit was released. Certainly, I think there have been some positive improvements, and I join the department in celebrating those. However, I also want to note that while identifying some areas of success, the audit team found consistent themes with the previous 2020 audit, including insufficient capacity and inadequate resources to participate in the co-management system, insufficient regulatory processes to address social, cultural, and economic concerns, industry concern with duplicative, costly approval processes for small-scale exploration, and continued challenges associated with resource management in regions without settled land claims. Mr. Speaker, the audit team found that there was an adequate response to 8 out of the 40 recommendations made in the 2020 audit report, with 17 partially implemented and 15 outstanding. Of these, the audit team determined 19 recommendations are still applicable and carried them forward. So, Mr. Speaker, I think it's clear there's been some good progress. As I noted yesterday, I am pleased that targeted amendments to the waters regs are proceeding, and I'm pleased to hear about the initiative to establish a one-stop shop for regulatory permits. It's great to see government being responsive to these issues. That said, I think we now need to focus on how we can move as quickly as possible in addressing outstanding or partially implemented recommendations. Mr. Speaker, yesterday I was casually chatting with our Strategic Infrastructure Minister, and it quickly became apparent to me that we didn't have a good mutual understanding of what really even needs to be fixed and addressed, despite having a recent report published by committee and now this newly released environmental audit. I think the outstanding recommendations of the audit are certainly a good place to start. But I think we also need to look at which of these recommendations have the highest potential to positively impact functioning of the system and set implementation priorities with timelines to get them addressed, so we know exactly what we're working on and help focus that work so it can be most effective. I encourage the relevant ministers to put their heads together and get this priority list together quickly, and would welcome reviewing it at committee. Thank you, Mr. Speaker.
Member statements. Member statements. Colleagues, it's with deep love and heavy hearts that I regret to inform you that the passing of Thomas Tommy Wilson, beloved father, husband, grandfather, teacher, and friend. Tom passed away peacefully on June 14, 2025 in Fort Simpson with his loving wife by his side. Born in Montreal, January 16, 1943, Tom was the eldest of 3 siblings, a proud big brother to Mary and Debbie. Tom and his family lived in many towns across eastern Canada. What a lot of people didn't know, Tom was an athlete. His favorite sport was rugby, which his oldest granddaughter, Reese, has taken on his love of the sport. She plays NCAA division rugby for the Queen's University of Charlotte. The other sports he liked was softball. I remember the young guns asking him to come out of retirement to play with them as their pitcher. This gave him the opportunity to play ball with 2 of his children. To make a long story short, thanks to his pitching and coaching, the young guns beat the Midnight Rangers in the finals. As a member of the losing team, I was very impressed with him and how he helped the younger players. Tom attended Teachers College in New Brunswick, where he met lifelong friends, Jim and Joan Weaver, who all made their way up north to start their teaching careers. They seemed to follow each other across the north. Before finding his enduring love with his wife, Ragley, he had 2 other daughters from a previous marriage. After his separation, he met Ragley in Broughton Island, with whom he had 2 other children, Mandy and TG. Soon after their children were born, they moved to Fort Simpson in 1980, where they built a home and became an integral part of the community. Tom was a devoted teacher, an active volunteer, servicing in the Lions Club, Senior Society, the Village Office, or Village Council, and various community projects. He taught in the high school, middle school, and elementary school. He taught many generations of students, including his own children and my children. He retired in Fort Simpson after teaching. His many years teaching students and countless hours volunteering gave him such pride. Tom was deeply woven into the fabric of Fort Simpson's life. He was always looking for a way to help improve the community. One of the highlights with him was implementing our instrumental member in the fundraising for the rec center in Fort Simpson. It was for our youth. He was always about his volunteering. About 2 years ago, upon 2 years moving to Fort Simpson, I had the opportunity to discuss the opportunity to start TV bingo in the community. Tom was very excited about this idea. It was one that would help fundraise for sports in the community, but more importantly, gave Ragley and his friends something to do on a Thursday night. Once that idea was set in place, Tom took on the role of organizer of the bingo night, and he was also there to help groups out. To this day, TV bingo has changed to radio bingo, but is still offered weekly in the community. Had the opportunity to see him in action as a volunteer and a member of the Village Council, where he served for many years as councillor, deputy mayor, and mayor. In 2016, he received the NWTAC Long-Term Service Award for serving on the Council of Village of Fort Simpson of the community for 27 years and being past board members of the board. Above all, Tom's greatest legacy is the love he shared with his children, grandchildren, and especially his wife. Their bond was the kind that made bingo nights scarce and driving around town memorable. The family would like to thank the Fort Simpson Long-Term Care Facility, their staff, and the community of Fort Simpson during their difficult time. Tom was preceded by his parents, Alice and George Wilson. He was survived by his wife, Ragley, his children, Mandy, TG, Lynn, and April, grandchildren, Noah, Reese, Allie, Charlie, and his sisters, Mary and Deb, and many extended family and members across the north. He'll be sadly missed. Member statements. Member statements. Returns to oral questions. Returns to oral questions. Recognition of visitors in the gallery. Recognition of visitors in the gallery. Member from Mackenzie Delta.
Thank you, Mr. Speaker. I too would like to recognize Lillian Elias. Lillian is the interpreter for the Legislative Assembly and provides an excellent service to the Legislative Assembly and to the Inuvialuit, and she also is a good friend of mine, and I'd like to just welcome her to the Assembly.
Recognition of visitors in gallery. Recognition member from the Sawtooth.
Thank you, Mr. Speaker. I too would like to recognize translator Lillian Elias. It was always cheerful to see her smiley face in the last couple of assemblies. She will be greatly missed. Mussy.
From the Sawtooth. Recognition of visitors in the gallery. Recognition of visitors in the gallery. If we missed anyone in the gallery today, welcome to your chambers. I'd like to thank you very much for allowing the 19 of us to represent the people of the Northwest Territories. I hope you are enjoying the proceedings. It is always nice to see people from the gallery. Acknowledgements. Acknowledgements. Oral questions. Oral question. Member from Frame Lake.
Mr. Speaker, my questions are for the Minister of Environment and Climate Change. Mr. Speaker, just following from my statement, has the Minister considered developing a priority list for actioning outstanding environmental audit recommendations? Thank you.
Thank you. Member from Frame Lake. Minister ECC.
Thank you, Mr. Speaker. Mr. Speaker, at this time, there's no essential prioritization of the items from the audit. Many of the items identified in the audit, as well as the outstanding items from 2020, are are quite cross-cutting and involve a number of partners that really don't all have the ability to participate at the same level. So as a department, we are certainly committed to the recommendations, and if within the audit report in tab D, I believe, it does lay out our commitments to those recommendations, as well as lays out specific timelines and whether we are fully committed and fully agree with the recommendations of the audit, or if we are in partial agreement, and again, what those timelines and commitments look like. Thank you, Mr. Speaker.
For ECC, member from Frame Lake.
Thank you, Mr. Speaker. Certainly, I appreciate that response. However, I think that there's probably some areas where GNWT does have full control, or even if areas don't have full control, setting them as a priority and saying that we want to get this one done quickly helps us communicate with our various partners as to why we're moving on something quickly. So I would just push back to the minister. I think it may be helpful to establish a priority list, and it will help us move these things from things that we're working on to things that we have done. So can I just ask the minister to maybe consider sitting down with the relevant ministers to establish a priority list based on our needs? Thank you.
Frame Lake, Minister of ECC.
Yes, thank you, Mr. Speaker. Mr. Speaker, you know, I appreciate the position of the member, and I think it's a really good point to raise. Many of the recommendations, you know, the work that's done on a lot of these are ongoing over long periods of time and have other contributing factors that sort of, you know, impact our ability to sometimes complete within the window of the audit. So within that 5-year window, and they may be continually ongoing through time. Certainly, I see a lot of value in, you know, as you say, what we have total control over as the GNWT, you know, in providing a little bit more focus. And I will certainly have that conversation with the staff at ECC. Thank you, Mr. Speaker.
ECC. Final supplementary, member from Frame Lake.
Thank you, Mr. Speaker, and I appreciate that commitment from the minister, and I think this is certainly something we could discuss at committee as well, and I don't think I have a follow-up question. Thank you, Mr. Speaker. Sorry.
Members, please make sure you have questions, not commentary. Thank you. Oral questions. Member from Range Lake.
Thank you, Mr. Speaker. Mr. Speaker, in order to keep the emergency room doors from closing, a shift bidding process was brought forward by the Health Authority, which was very successful, and we were able to recruit the locum doctors we needed to prevent that from happening. At the time, it said this process would be retired, but it would inform future decisions. Can the minister relate to the House how this successful strategy will change staffing, retention, and recruitment in the future for NTHSSA? Thank you, Mr. Speaker.
From Range Lake, Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, the Health Authority, alongside with the physicians, came up with a solution to deal with the vacancies that were in the summer. Right now, we're continuing on to, I think, look forward to the interest-based bargaining with the physicians as part of ways to work with our recruitment. I know that at this time we are looking at possibly this, you know, to utilize this in times when we see areas of high needs, and so that is, since the successful over the summer, we will look at it possibly if that situation comes up if we start to notice that we're seeing more vacancies for our Christmas and next summer. Thank you, Mr. Speaker.
Minister of Health and Social Services. Member from Range Lake.
Thank you, Mr. Speaker. Well, that seems to be a change in plan. So, I must be mistaken in that this was going to be abandoned, and they were going to move to a more sustainable model of staffing. So, what is the plan for, not for doctors, but for nurses and the allied medical professionals who work in the ERs, because they need to be compensated as well. They're working very hard, and they're as frustrated with their working conditions as any doctor. Thank you, Mr. Speaker.
Rangeley, Minister, Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, as the physicians are contracted to the NTHSSA through their own bargaining process, the nurses and other allied health professionals, they do their bargaining through the collective agreement currently. Thank you, Mr. Speaker.
Member from Minister of Health and Social Services. Final supplementary. Member from Rangeley.
Thank you. So it sounds like the minister is saying because of that collective agreement, we can't offer any kind of labor market supplement or wage or shift premium or something like that. What options does the minister have available to her that she could work with the union to bring this forward? It must be possible, because we've been having these discussions about healthcare. We saw what happened during COVID. We have a private members bill that we've been debating as well. Clearly, this is an issue that needs to get fixed. We need to compensate nurses. When's the minister going to do it? Thank you, Mr. Speaker.
Member from Rangeley, Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, we just agreed on a new collective agreement, which increased more than nurses. It increased all the nurses' labor market supplement. It increased social workers. It added other healthcare providers in this collective agreement. So we have done that. Finance and the NTHSSA, through bargaining, did increase all those labor market supplements. Thank you, Mr. Speaker.
Minister of Health and Social Services. Oral questions. Oral questions. Member from Yonge Centre.
Thank you, Mr. Speaker. My questions will be directed to the Minister of ECC with respect to encampments. There was a press release. I'll give everyone to go to the wiki page to find out who he is. He doesn't get a lot of questions here, so I want to see him rise here. I know he'll do a good job. Good point, Mr. Speaker. Mr. Speaker, there was a press release on May 25th of this year, talked about encampments, basically there they are, talked about inspections. I want to know what ECC is doing about inspecting these encampments to make sure they comply as the rules such as the safety, proper use of public lands, complying with fire and waste safe guidelines. That falls under his purview and stewardship. Thank you.
Member from Yonge Centre, Minister ECC.
Thank you, Mr. Speaker. Mr. Speaker, the Department of ECC does have officers that will do patrols to ensure that when requested, that if there's a site that's specifically has a potential issue and they're asked to do an inspection, they will gladly go and do that inspection. If there are issues that are seen to be evident at the site, they will attempt to work with the folks that are there and resolve those. And if required, there are other legal avenues that could be pursued to come to a resolution. Thank you, Mr. Speaker.
Minister of Environment and Climate Change. Member from Yonge Centre.
Thank you, Mr. Speaker. Mr. Speaker, with respect to inspections, it sounds like they don't happen or they may happen sparsely. We've now had two encampment problems that had serious fires, and recently, as I pointed out even today, I saw piles of propane tanks. What does it take to have daily inspections from this department to ensure that they're safe on public lands, to make sure that they meet the guidelines highlighted in the press release on May 25th? Thank you.
Centre, Minister of Education, or Environment and Climate Change.
Mr. Speaker, so the encampments within the boundaries of the city are also partially a responsibility of the city, and there are certain bylaws that happen within the city that are relevant to the city that would need to also be adhered to. Environment and climate change officers look specifically to the areas in which are under our purview, and certainly these periodic inspections are just that. They're periodic, and it's not the intent of the department to be doing daily inspections to a point where it's harassment type of activity. So we engage when required and try and ensure that we're doing that in a respectful manner. Thank you, Mr. Speaker.
Thank you, Minister of ECC. Final supplementary, member for Milne Centre.
Thank you, Mr. Speaker. I believe I've sent this minister directly concerns under his justice portfolio hat of the encampment downtown and causing concerns. There's even pictures out there of piles of jerry cans sitting there. Mr. Speaker, what does it take for this minister to get over there and inspect these encampments, if we're going to allow them to happen, to ensure that they're safe so no one dies in this situation, because that's the last thing we want, and it'll be such an impossible situation to take back. Thank you.
Member from Milne Centre, Minister ECC.
Thank you, Mr. Speaker. Mr. Speaker, the direct inspections and addressing of these things are done by the officers on the ground who have a mandate to do such work. As Minister of Justice, it's not my mandate. I certainly do have regular conversations with the folks at Justice, to ensure that we are considering these. But once again, those things fall directly under the specific agency or department that have the mandate to enforce that. And I do not directly involve myself with the enforcement part of that work. Thank you, Mr. Speaker.
Minister of ECC. Oral questions. Member from Great Slave.
Thank you, Mr. Speaker. Mr. Speaker, this summer the minister committed to reviewing the Yukon government's model for gender-affirming care navigation services and exploring options for similar system navigation supports for trans and gender diverse clients here in the NWT. Can the minister provide me with an update on that work or an estimated time of completion? Thank you, Mr. Speaker.
Slave, Minister of Health and Social Services.
Thank you, Mr. Speaker. And yes, this summer I did have the opportunity to sit down and meet with the Northern Mosaic Network. The work to explore gender-affirming care navigation support is underway, and it's being approached collaboratively with the Northern Mosaic Network. This work involves multiple areas, including policy, clinical operations, patient services, and financial planning. The Northern Mosaic Network is interested in working with us on this initiative, and they are in the process of setting up a multi-sectoral working group that will include government and health representatives. Initial discussions have taken place and information being shared to help support the group's development. Before moving forward, we need to look at what we already know, learn from other jurisdictions, assess our current services and future goals. This will help us to ensure any supports we develop are effective and sustainable, and we are committed to continuing this partnership. Thank you, Mr. Speaker.
For Health and Social Services. Member from Great Slave.
Thank you, Mr. Speaker, and thank you to the minister for continuing that good work. Mr. Speaker, in 2022, the Yukon government worked through regulatory changes to their Health Care Insurance Plan Act that allowed them to provide expanded care to private clinics for gender diverse Yukonites? Can the minister tell me if her staff or the Health Sustainability Unit staff are able to provide insights and an analysis as to whether gender-affirming services that are in line with the Yukon services could be considered core and/or insured services? Thank you, Mr. Speaker.
Member from Great Slave, Minister of Health and Social Services.
Thank you, Mr. Speaker. And Mr. Speaker, yes, we are aware of the changes that have been done in Yukon, and Yukon's approach is unique and reflects its own priorities, but it's helpful for us to look at. At this time, I'm not aware that the Health Sustainability Unit is actively reviewing the Yukon model, but it's something that we can, explore in the future. I know that they are reviewing the out-of-territory services, so we'll certainly look at what other jurisdictions are doing, including Yukon, to see what lessons we can learn from them. And this will be done in partnership with the Northern Mosaic Network. Thank you, Mr. Speaker.
Minister of Health and Social Services. Final supplementary. Member from Great Slave.
Thank you, Mr. Speaker. Mr. Speaker, again, as the minister has mentioned, she sat down with the Northern Mosaic Network this past July, and at that time they requested that the minister and the GNWT provide formal recognition that trans health is a priority and visible action to back that up at all levels, from policy to frontline care. Would the minister care to comment on this request at this time?
Thank you, member from Great Slave. Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, ensuring access to quality, equitable care is one of my highest priorities. We know that the system still faces challenges in delivering that care, and improving access remains a key focus for myself, including as minister, and including for transgender, non-binary, and gender-diverse people. We're taking meaningful steps to strengthen our system and eliminate barriers residents face while, one, trying to access the care that they need. And we are committed to working in partnership with the Northern Mosaic Group to ensure that this is done thoughtfully and inclusively. Thank you, Mr. Speaker.
Thank you, Minister of Health and Social Services. Oral questions. Member from Yellowknife North.
Thank you, Mr. Speaker. I have questions today for the Minister of Finance. As the government has committed to bring forward legislation by fall of 2026 regarding Phase 2 changes to the Public Service Act, specifically addressing Section 41 and the right to freedom of association, can the minister tell us what kind of public engagement on this initiative is planned for the coming winter? Thank you, Mr. Speaker.
From Yellowknife North, Minister of Finance.
Thank you, Mr. Speaker. Mr. Speaker, the very first step, which is happening as early as next week, is to engage in bargaining partners, which is to say the unions, so that they are fully aware and involved in the path that we may choose. As I am noting, that starts next week with the Public Service Alliance of Canada and the Union of Northern Workers, and then the Teachers Association thereafter. And Mr. Speaker, we'd be scoping out some opportunity for public engagement thereafter, but still noting that there was a commitment here to have a legislative proposal ready to roll for the Assembly early in the winter, so it will have to all happen fairly quickly. Thank you.
Finance. Member from Yellowknife North.
Thank you, Mr. Speaker. So will the government only be reaching out to identified stakeholder organizations to meet privately, or will there be a wider call for public input or perhaps public meetings to be held? Thank you, Mr. Speaker.
Member from Yellowknife North, Minister of Finance.
Mr. Speaker, there is going to be the Have Your Say website that is available, and folks are hopefully familiar with that tool. It is used across the GNWT. That will be coming out this calendar year, so certainly will send that to my colleagues and hopefully get the word out to the public that that's happening, and certainly would want to encourage anyone who's interested. Traditionally, Mr. Speaker, this would be a piece of legislation that, because it focuses on the public service and is a tool related to the public service, wouldn't have necessarily gone through as extensive as a public engagement. We, of course, have the benefit of having gone through some public engagement related to that, but would encourage anyone that would still like to participate in this particular process to be looking for it this year. Thank you.
Minister of Finance. Final supplementary. Member from Yellowknife North.
Thank you, Mr. Speaker. So given that there's already been substantial public input on this topic received by the Standing Committee on Government Operations as part of its review of Bill 26, in order to avoid asking people to engage over and over again on the same topic and risk consultation fatigue, will the minister ensure that staff review the complete public record from the review of Bill 26 to include those materials as they develop the legislation? Thank you, Mr. Speaker.
From Yellowknife North, Minister of Finance.
Thank you, Mr. Speaker. And Mr. Speaker, I do appreciate the comment. I do think that over-engagement is something that does tend to happen and can happen and can detrimentally affect the outcomes that we want. So, Mr. Speaker, I'm happy to say that I will direct to ensure that the staff working on this treat the information that was received during the public process the same as they would information that we would receive during a government-led process. There'll be no two-tiering of it. I can also assure the member in the House that they've already been watching. I have frequently heard from them as the process was going through that they were already watching and hearing what was happening. So, but certainly, again, as I say, the information will not be treated differently. Thank you.
Oral questions. Member for Moultrie.
Thank you, Mr. Speaker. Mr. Speaker, in July 2024, the government announced improvement to the income assistance program that resulted in increased benefit levels and income exemptions and reduced barriers to accessing the program. What step is the department taking to align income support with employment and training programs so that recipients are encouraged, not penalized, for pursuing work or education? Thank you.
Minister of ECE.
Thank you very much, Mr. Speaker. Mr. Speaker, the biggest change that occurred with the changes that were made in regard to income assistance, in regards to pathways to employment, was the ability of residents who are on income assistance to keep an increased amount of earned income. So they've increased it to $500 per adult plus 25% of income over that. And so what that does is it provides people a grace period to re-enter the workforce where they're not going to get clawbacks. And so it's a safety step for residents who are on income assistance and a critical part for us being able to support that transition. Thank you.
For employment. Member from Moultrie.
Thank you, Mr. Speaker. Has the department conducted any reviews or evaluations to access how current income assistance policy may be discouraging recipients from pursuing employment or education? Thank you.
Member from Moultrie, Minister of Education, Culture and Employment.
Thank you very much, Mr. Speaker. Mr. Speaker, in the 19th Assembly, an extensive review of the income assistance program was done by Education, Culture and Employment, and the changes that we saw take place last year were as a result of that work. Thank you.
Minister of ECE. Member from Moultrie, final supplementary.
Thank you, Mr. Speaker. Mr. Speaker, does the department track how many income support recipients successfully transition into employment or education? And if so, what are the current outcomes? Thank you.
Minister of ECE.
Thank you very much, Mr. Speaker. Mr. Speaker, we do our best to make sure that we have an idea of, first of all, where people are at, what their goals are, and how we can support them to get there. This program is just now entering into its second year of being the new directive by Education, Culture and Employment in its current form. And that's not information that I have in front of me here, nor information that we would have had the opportunity to collect and analyze so young into the infancy of this next program. Thank you.
Minister of ECE. Oral questions. Member from Mackenzie Delta.
Just a minute. Thank you, Mr. Speaker. The infrastructure within the affected communities of the closures of the community centers could and should benefit the community and its residents. There are a lot of aging infrastructure within these communities, and these buildings could help in that area. With all the affected communities within the Northwest Territories, how many organizations have expressed interest for the use of these buildings for the benefit of their respective communities and its residents? Thank you, Mr. Speaker.
Member from Mackenzie Dalton, Minister of ECE.
Thank you very much, Mr. Speaker. Mr. Speaker, we've certainly received interest from multiple communities in regards to the community learning centers. In some communities, the answers and the next steps have been easier than others. So, for example, if we have a community learning center that's found in a school already and the school needs that infrastructure returned for their higher capacity, we've done that already. In other communities where there's school infrastructure improvements going on, we have maintained the presence of students in the community learning center in order to prioritize the delivery of education in those communities. In some instances, though, Mr. Speaker, multiple Indigenous governments or community governments have expressed interest, and so it's not as easy as picking one over the other. And I have been approached by different levels of governments from some communities and have, as a first step, asked for them to work together and to return with a collaborative application, if that's a possibility. So that's the first step, Mr. Speaker. Thank you.
Member from Mackenzie Delta.
Thank you, Mr. Speaker. How many consultation meetings was there between the minister and interested organizations to discuss the plans for these buildings for community use? Thank you, Mr. Speaker.
The Minister of ECE.
Thank you very much, Mr. Speaker. Mr. Speaker, when I was asked for meetings, I certainly was able to attend them and happy to do so. But for the most part, these meetings happen between officials because a lot of the times the information that's being requested is operational and fairly in the weeds. People are looking to understand the cost of operating these buildings and more finer details about the infrastructure itself. Thank you.
ECE. Final supplementary, member from Mackenzie Dalton.
Thank you, Mr. Speaker. Being more specific, I was contacted by 3 organizations within my riding and asked to advocate on their behalf, and I did. How successful were the interested organizations from Sigachik and Aklavik being conducted? Thank you, Mr. Speaker.
Mackenzie Dalton, Minister of ECE.
Thank you very much, Mr. Speaker. So, Mr. Speaker, when I'm talking about competing interests in some communities, that is relevant to some of these conversations, and so that's why I've asked to make sure that all of the interested parties are on the same page before picking one over the other, because I think in some instances there's an opportunity for collaboration in some of these communities. Thank you.
ECE. Oral questions. Oral questions, member from Toonaday-Willety.
Thank you, Mr. Speaker. Mr. Speaker, the remains of more than 70 children lie at the former St. Joseph's Residential School in Fort Resolution, and more families are still waiting to bring their children home. In the spirit of reconciliation, this work must continue. My question is to the Premier, Mr. Speaker. Can the Premier confirm that this repatriation work will continue this spring? Thank you, Mr. Speaker.
Member from Toonaday-Willety. Mr. Premier.
Thank you, Mr. Speaker. That's up to the families. The families can make a request to have that done, and there's processes in place to make that a reality as we're seeing today. And so I don't see any reason why this wouldn't continue next year if the families wish it to continue. Thank you, Mr. Speaker.
Member from Toonaday-Willety.
Thank you, Mr. Speaker. Mr. Speaker, the long and painful process to bring Alma home must not be repeated. Will the Premier bring forward a residential school grave site repatriation act in order to align our legislation with UNDRIP so that no matter the unique challenges of each grave site across the North, every family has a consistent right to bring their loved ones home if they so choose? Thank you, Mr. Speaker.
Thank you, member from Toonaday-Willety. Mr. Premier.
Thank you, Mr. Speaker. And now that we understand this process as played out this year won't happen again. So I can promise the member that as long as we have proper flow of information, we can proceed through these instances without any issues. In terms of bringing forward a residential school gravesite repatriation act, I can say that the Minister of Education, Culture and Employment oversees the Archaeological Sites Act, and that is one of the pieces of legislation that has to go through the Intergovernmental Council for amendment or repeal and replace or whatever the case may be. And so those conversations have begun, and we're having an Intergovernmental Council meeting in the coming months, and I expect this will be discussed there. Thank you, Mr. Speaker.
To Mr. Premier. Final supplementary, member from Toonaday-Willety.
Thank you, Mr. Speaker. And yeah, as claims get settled and the agreements come to fruition, there will be parts of that in there as well. So, Mr. Speaker, we work together alongside the community to find creative solutions to the outdated policies that were standing in the way. How does the Premier see this kind of collaboration as a foundation for advancing meaningful reconciliation as we work to implement UNDRIP and the TRC calls to action? Thank you, Mr. Speaker.
Toonaday-Willety. Mr. Premier.
Thank you, Mr. Speaker. I think this instance highlights the importance of working together. The fact is there were processes in place, very clear defined processes that in the end they were followed. The problems were that the information that was needed to initiate those processes wasn't understood by everyone involved. And so my office became involved in this, and there were daily phone calls to try and gather this information. And once the entire picture was in view, we were able to proceed through an established process to get to where we needed to go. So with that understanding, we realized that there's reconciliation, there's also truth and reconciliation. And so we need the truth, we need the information. We all need to know the facts around situations, what the processes are, and we have begun to establish those connections with the team in Fort Resolution, with leadership in Fort Resolution. And now that we have that in place, I don't foresee any issues going forward now that everyone understands the situation and has the right connections. So once again, communication and partnership are the key to success here. Thank you, Mr. Speaker.
Mr. Premier. Oral questions. Member from Decho.
Thank you, Mr. Speaker. My questions are to the Minister of ECE. Given the clear need for small business supports in regions like the Decho, what specific steps is the Department of Industry, Tourism and Investment taking to reduce regulatory barriers and streamline access to programs and resources for entrepreneurs in remote communities? Thank you, Mr. Speaker.
So I think we're going to Minister of ITI. Yes. Minister of ITI.
Luckily, it's the same person. Thank you, Mr. Speaker. Mr. Speaker, in regards to what ITI is doing to streamline access to programs and services, we've migrated all of our funding programs under the same grants and contributions policy for consistency. We also have regional decision-making as far as our grants and contributions go. I am happy to say that a significant amount of funding flows both from ECE and ITI and also Prosper NWT across the regions. And as far as Prosper NWT is concerned, actually 83% of dollars from Prosper flow outside of Yellowknife. Thank you.
Minister of ITI. Member from Decho.
Thank you, Mr. Speaker. The Regional Economic Development Plan highlights the lack of skilled workers as a major constraint to business growth. What investments is the department making to support workforce development and improve access to training in the Decho Riding? Thank you, Mr. Speaker.
Member from Decho, Minister of ITI.
Thank you, Mr. Speaker. Mr. Speaker, it's a long list, but I'll keep it short in the interest of time, and I'm always happy to speak about this in more detail with the member as well. So as a few examples, we do mentorship sessions in all of our regional centres. 3 of those happened in the members' riding. In addition to that, we also have career development officers as well as economic development officers across the Northwest Territories, and they all came together and gathered for a conference to share ideas, share information about programs that they could take back to their regions. I want to slow down, Mr. Speaker, sorry. And that conference just happened last week, so I'm very excited to hear the success of that time together. In addition to that, Mr. Speaker, Education, Culture and Employment also does have workforce development training programs that are available to employers to help employ Northerners who need a boost in skill sets in order to meet the job that employers are working to get them into. So we have both programs that support the development of an idea and programs that support the development of a workforce. Thank you.
Minister of ITI. Final supplementary. Member from the Decho.
Thank you, Mr. Speaker. With high cost of living and limited infrastructure cited as barriers to small business success, how is the department working with other GNWT departments to improve internet connectivity, housing availability, and transportation infrastructure in the Decho Riding to support economic development? Thank you.
Of ITI.
Thank you very much, Mr. Speaker. Mr. Speaker, Industry, Tourism and Investment is involved in the increase of infrastructure both within its department, but then also by the opportunity I have to work with my colleagues. So specifically for the Decho region, there's infrastructure when it comes to tourism. That's a program that is housed within ITI. Then when it comes to housing, for example, the minister and I do work together on ideas for how we can grow a skilled workforce, and we've got a couple that we've been pairing up on that we're still baking that cake, Mr. Speaker. And then in regards to the departments working together, the department is working very closely with ITI and housing right now on as far as how can we work together to build microclusters of industry across the territory. As far as myself and the Minister of Strategic Infrastructure, we sometimes work too closely together and end up repeating or finishing each other's sentences. And so it's not just infrastructure development just for one region or another. We really do look at it from an all-of-territory perspective, because this is really the time we need to capture opportunity for the entire Northwest Territories. It needs to be now. Thank you.
Thank you, Minister Baitia. Oral questions. Member from Yelney Centre.
Thank you, Mr. Speaker. Mr. Speaker, I want to go back to my member statement where I talked about the housing policy and concerns lack thereof. It was built on my statement even as of yesterday and given the circumstances. Mr. Speaker, why don't we start with a softball? Have anything I said today resonated in a manner that the minister is willing to go back and see if we can accelerate the encampment policy to ensure people are safe and whatnot? Because I really know she's got a great shop there, and they could do this without waiting to the spring of 2026. So did that hit a tone of urgency from the minister? Thank you.
Member from Yelney Centre, Minister responsible for housing and NWT.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. The tone and understanding and the situation with encampments in the city of Yellowknife is urgent. I understand that, and I understand the urgency and the tone from the member. Housing NWT is working within its policy shop and looking at delivering an all-of-government approach in terms of policy. We work in partnership with the Yellowknife Partnerships Committee, work in collaboration with other departments, including EIA's Integrated Service Delivery. We have to have this reviewed by many other departments. We have to be careful in our policy. We can't rush a policy, but we are working to deliver something. Thank you, Mr. Speaker.
Thank you, Minister responsible for housing and NWT. Member from Yelney Centre.
Again, Mr. Speaker, I know this minister has the ability to do this, and I know the policy shop exists, and I know they have the talent to go liberate wording and structure from everything. Is there any reason that the minister couldn't agree today that she could come up and table a draft policy by the last day of this session that gives just over a week to come up with something, and we can put a footnote saying, and we're still going to develop this in partnership with our colleagues, Mr. Speaker, and we would have something in place to move forward. Thank you.
Minister responsible for housing and NWT.
Thank you, Mr. Speaker. Understanding Housing has 99 employees across the Northwest Territories, and we take care of 2,900 units across the Northwest Territories, working with 23 different LHOs, and we have two employees in the policy shop. I mean, we have to look at things carefully. Understanding the concern, the urgency around encampments, and this has been ongoing for the last number of years. We have committed to deliver something in spring of 2026, but I'll ask the President of Housing NWT if anything can be done sooner. Thank you, Mr. Speaker.
Minister responsible for housing and NWT. Final supplementary. Member from Yelney Centre.
Thank you. I'll take that olive branch, Mr. Speaker, because safety matters. Mr. Speaker, the last piece I'll take and ask, or sorry, the last piece I'll ask in this particular case, again, speaks to my member statement, which is what are they going to do in recognition that you are the lead minister on this homelessness issue to ensure that these encampments are inspected, people are safe, and we don't have another fire? And lastly, Mr. Speaker, this was right next to a pile of propane tanks, and I even heard that one went off. So, thank you.
Member, there's two questions in that, so I'm going to let the minister give her the flexibility to answer how she wants to. Minister of Housing, NWT.
Thank you, Mr. Speaker. Mr. Speaker, Housing NWT and the Integrated Service Delivery Unit has been working really closely with all the encampment folks, and this has been multiple encampments throughout the summer and the fall time. We're hoping to move on transitional housing by December of this year. Again, we are providing weekly visits to all the encampments throughout Yellowknife, and there's, again, multiple encampments throughout Yellowknife. But again, these are conversations that we have, and we can counsel, but people have the freedom to do what they want, provided it's done in a safe manner. So they have to follow regulations, they have to work with the city, work with the bylaw, work with the RCMP, work with the fire department, and I'm so grateful, Mr. Speaker, that there was no one hurt in this encampment. So and again, grateful for frontline first responders and also for the Yellowknife Fire Department. Thank you, Mr. Speaker.
Minister responsible for housing and LUT. Oral questions. Member from Range Lake.
Thank you, Mr. Speaker. Mr. Speaker, the Healthcare Sustainability Unit has determined that we pay just about double for healthcare in the Northwest Territories. Healthcare funding is a quarter of our budget, and the deficit is expected to be $350 million, which is consistent with deficits that have been climbing over the years. That's why we have the unit. Question is, what is the public administrator doing to curb this deficit, to bring sustainability to the unit? We know how much it costs now. What is he doing to bring those costs down? Thank you, Mr. Speaker.
Hear, hear. From Range Lakes, Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, there is a lot of work that is going on. The public administrator over this past year has, one of the most important things is that he had to go out and he had to attend and hear from the regional wellness councils. He attended all of the regions. We highlighted some of the areas where he's been working alongside with the NWT Medical Association. There is an ongoing process that's going on right now. The last budget that they tabled actually decreased, I think it was $20 million out of the current would have been a deficit, and throughout the year they're continuing on trying to find resources within, they're trying to streamline, they're working with the Health Sustainability Unit, they're working with the department to try and do some of those things. They're looking at right now, they've presented they're presenting me with with looking at different org structures. We're looking at the governance model. So these are the things these are all pieces that are kind of all going on all at once. So there is a lot of work going on. Thank you, Mr. Speaker.
For Health and Social Services. Member from Range Lake.
Thank you, Mr. Speaker. Mr. Speaker, the largest cost driver for these deficits is the medical travel system. I've been told by constituents that they are being scheduled on multiple trips for procedures that could be grouped together into one trip, so you could have all four done instead of being spread out. And what they're being told is, well, people like it this way. So are we letting the personal preference of medical travel clients dictate our spending efficiencies, or are we actually applying some policy here to make sure we're providing the most cost-effective use of taxpayer dollars? Thank you, Mr. Speaker.
Hear, hear. Range Lake, Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, the medical travel policy as it stands right now, there is, I too have heard of that. I haven't, I followed up with the department. What is happening within the department is physicians order, they book the appointment. Not all the time are they're going to different facilities within Alberta Health Services when they're leaving, or they're coming from the smaller communities into the capital at different periods of time. And when the person that's booking the travel, they get the piece, they don't know what they're traveling for, they just know they're traveling, they book it. I have followed up on that comment because it did come to my attention. I haven't had a response back, but my understanding is that is not the policy, that is not allowed. It is based on the need of the medical travel. What we are looking at is more looking at streamlining that, and there is work going on within the Health Authority right now to create that streamlining of appointments. Thank you, Mr. Speaker.
Minister of Health and Social Services. Final supplementary. Member from Range Lake.
Thank you, Speaker. In terms of the complaint that I received, the patient actually pushed back and said, please book it all at once so I don't have to do 4 trips. They didn't want this. So will the minister commit today to end this waste that's going on in the system and ensure that we streamline appointments so they're all happening at the same time? Will she commit to fix that in the medical travel policy today? Thank you.
Hear, hear. From Range Lake, Minister of Health and Social Services.
Mr. Speaker, I have given that direction. I will reinforce that direction back to NTHSSA. I also have, and I mean, I'm going to say that on the other side of it, it is sometimes we try to streamline them. Patients, there are certain things that they need to be seen sooner, and another appointment can't be. We will make those accommodations, but that is not the norm. Thank you, Mr. Speaker.
Minister of Health and Social Services. Oral questions. Member from Mophly. Sorry. Yep, Mophly.
Thank you, Mr. Speaker. Mr. Speaker, this is a question for Minister of Finance. I want to ask the Minister of Finance, can the minister provide details as to how the available funding contemplated under the Emergency Evacuation Relief Program was determined? This outcome really changed from forest fire 2023. Thank you.
Minister of Finance.
Thank you, Mr. Speaker. And Mr. Speaker, prior to 2023, there was no form of reliable or consistent relief funding whatsoever. In 2023, initially after the South Slave regions had experienced multiple evacuations, the department started to try to, on an urgent basis, create some sort of system or a program to support folks. And now with that, Mr. Speaker, in 2023, we developed a couple of different programs, and the feedback was that that was complicated. And so on review of those programs, it was after that review that a determination was made to have a single website system where folks who were evacuated could register and would then be able to access the relief program, and would be one that would align roughly with similar to the types of supports that go to someone who's on income support and gets an emergency relief payment in that regard. Thank you, Mr. Speaker.
Finance. Member for Moseley.
Thank you, Mr. Speaker. The lump sum funding provided for under the Emergency Relief or Evacuation Relief Program does not take into account the actual amount of time a resident has been evacuated from their home community. Doesn't take into account the actual costs residents have incurred. Can the minister explain why this is the case? Thank you.
Minister of Finance.
Thank you, Mr. Speaker. Mr. Speaker, what this is meant to cover are sort of incidentals, if you will. So at this point, it's still through the emergency management organizations where transportation to or from an emergency relief location is provided, access to accommodations at an emergency relief location is provided, other expenses, for example, mainly food is provided. And at those occasions, there is triaging that is done with all best efforts so that someone who's not able to remain in a group accommodation circumstance can access different types of accommodation, hotels, for instance. And of course, there's work that continues on in the nonprofit sector to support municipalities who are often at the front lines of providing all those services. So all of those services remain in place, and this is meant to really provide a bit of a one-off incidental support. It is not meant to cover people's actuals in the course of an emergency, nor is it necessarily meant to cover off the fact that emergencies can be short and they can be long. We do keep an eye on what's happening in the rest of Canada, Mr. Speaker, and we continue to remain one of the most generous jurisdictions in this regard. Thank you.
Final supplementary. Member for Moseley.
Thank you. The program as currently structured is inadequate, given that natural disasters and the potential for community evacuations are unpredictable. Meanwhile, the cost for accommodations, groceries, gas, and other essentials continue to rise. Even till this day, like many of our private businesses and citizens from Forest Fire 2023 are still affected, recovering financially. So with that in mind, will the minister commit to a review of this program to ensure that in the future it is more flexible and equitable, especially for small communities? Thank you.
Minister of Finance.
Thank you, Mr. Speaker. As I had mentioned at the beginning, Mr. Speaker, the individualized relief program, which is a cash payment, that program was reviewed after the 2023 evacuations and fires, and the changes that we've made were in response to that. I'm obviously well aware that there's been an after-action review of the broader response with respect to the wildfires here and the way in which that's managed. And again, all but the one recommendation are being accepted and advanced by the government of the Northwest Territories as a whole. Mr. Speaker, there's not going to be an additional and second review after just 1 year and a year and a half of this emergency relief program. I certainly will commit that we will keep an eye on what the rest of Canada is doing. As I said, we right now are one of, if not the most overall generous jurisdictions in terms of what we provide to our residents in the case of emergency services, notwithstanding that we go to the federal government and have to fall into their categories to get any kind of compensation for the events happening here. But so we will keep an eye on what's happening. We want to make sure our residents continue to be serviced, but there won't be an additional review of this particular program. Thank you, Mr. Speaker.
Finance. Oral questions. Member from Great Slave.
Thanks, Mr. Speaker. I also have questions for the Minister of Finance. She used to be known as the Minister of Red Tape Reduction. Don't know if that's still the case. I know and she knows that, and I think this whole government and this whole House knows that NGO pockets are not deep. You have to often include liquor sales at events, and going and getting a liquor license as a one-off for NGOs that may not do events with liquor sales regularly is a complex process. I've brought this forward to the Minister in the past, and she's told me they're working on it. So I'm wondering if the Minister can give me an update on any timelines that she might have as to whether or not the liquor license folks are looking to bring these pieces into an e-services portal. Thank you, Mr. Speaker.
Member from Great Slave. Minister of Finance.
Thank you, Mr. Speaker. Let me jump to the very end there, Mr. Speaker, with respect to e-services. That happens to also fall under the Department of Finance and is something near and dear to my heart that I think flies too far under the radar sometimes in terms of the service benefits it can provide. That said, I don't have a date right now. I will certainly be happy to commit to getting that information, and we'll certainly look to advance to the extent that we can, that should be one of the next areas that we look to move, if possible, to one of the online e-service areas. That is continually evolving. So again, Mr. Speaker, I will most certainly look at with the two branches of the department. I suppose the other piece of that is that the regulation work is underway to finalize the regulations for the new Liquor Act, and one of the things that has been emphasized is to do everything in those regulations to streamline access to licenses in a safe manner. Thank you, Mr. Speaker.
Member from Great Slave.
Thank you, Mr. Speaker. I look forward to those updates. Mr. Speaker, I know there's also overlap, and sometimes when you're a small NGO with limited resources and you aren't putting on events with liquor that often, you don't necessarily realize that you also need a special occupancy permit from MACA. You have to jump all over the government and figure it out yourself. And then there's timelines associated, which makes it more complicated. So can the minister tell me what she's doing to streamline sort of a fulsome package for people when they need a liquor license and all of the pieces that are included? Thank you, Mr. Speaker.
From Great Slave, Minister of Finance.
Thank you, Mr. Speaker. This is, I can certainly confirm, it is an area that the two departments are working on together, and they are looking to ensure that they are putting forward a package that is aligned and cohesive between the two. Mr. Speaker, I'm happy to commit to get a detailed timeline on that work. I didn't bring it in front of me here today, but I have heard this issue raised many times. It's not only a matter that affects NGOs, it's one that can hinder the availability of arts programs and festivals and activities that really can bring a lot of life to the communities. So I am more than happy to continue working with my colleague and to commit that we'll get a date to see that when these two departments can have a plan and a process, and really my goal will be to have it in time for the festival season this spring. Thank you.
Finance. Oral questions. Oral questions. Member from Yellowknife North.
Thank you, Mr. Speaker. I wanted to ask the Minister of Municipal and Community Affairs, following up on questions I was asking last week. So the After Action Review said that a lack of a unified command between the GNWT, municipalities, and Indigenous governments led to overlapping operational priorities, decision-making delays, and public confusion. While there was not an official recommendation about this, will the minister undertake, as the report did recommend sort of within the text of the report, to practice unified incident command with the City of Yellowknife and other large NWT municipalities, including joint participation in drills with city staff and partners? Thank you, Mr. Speaker.
Member from Yellowknife North, Minister of Municipal and Community Affairs.
Thank you, Mr. Speaker. Again, so some of the line of questioning is related to the after-action review and the recommendations. And what we've done is those recommendations have been actioned and are being actioned, so we are moving ahead. So although some of the after-action review has said we're not doing some of this stuff, it may have changed already, and we are actually doing some of this stuff. For an example, with the unified command. So back in 2023, there may have been that confusion on how to operate with the ICS and the unified command. Going to today, there's a lot more clarity on the operations, more clarified roles and how we operate with the ICS, and more working exercises, more tabletop exercises, more training opportunities. Currently, I think it's actually next week that Operation Nanook is being held in Yellowknife, and there's an opportunity there for the City of Yellowknife, the GNWT, DND, and obviously other agencies working together to, as a tabletop exercise, as an exercise in order to how to operate in ICS and clarified rules. Thank you, Mr. Speaker.
Minister, Municipal and Community Affairs. Member from Yellowknife North.
Thank you, Mr. Speaker. So I wasn't quite clear from that response. I wonder if the minister can clarify, is the GNWT already operating in a unified command or unified incident command structure with the City of Yellowknife, or is this something that it's working towards? Has the minister committed that in all future emergencies there will be a unified command? Thank you, Mr. Speaker.
From Yellowknife North, Minister, Municipal and Community Affairs.
Thank you, Mr. Speaker. Yes, to clarify this, as part of the training and as part of our review and the new ICS training, the roles and responsibilities state to work in a unified command, and that is with all community governments, not just City of Yellowknife, all community governments, all agencies work in a unified command, and that's the only way emergency management operations would be handled in order to ensure that proper procedures are done and that all the agencies have the proper resources and tools to action that type of emergency. Thank you, Mr. Speaker.
Of Municipal and Community Affairs. Final supplementary. Member from Yellowknife North.
Thank you, Mr. Speaker. So the after-action report details the story of how the hamlet of Enterprise was excluded from fire risk communications with ECC and the REMO until it was almost too late to evacuate, and that was due to lack of situational awareness, lack of clarity on decision-making roles. So what exactly has changed to ensure that that will not happen again? Thank you, Mr. Speaker.
Member from Yellowknife North, Minister, Municipal and Community Affairs.
Mr. Speaker, again, going forward, there's been more clear communication. There have been more working amongst departments with the ICS system. There's been more communication between departments. And just to highlight, communication has always been an issue and it's still an issue on many emergency scenes, and communication is usually highlighted in every after-action review. So it's definitely something that needs to be worked on, all the time, just to understand that. So, although the review explained about Enterprise, there was a lot of things going on, a lot of confusion. There was a lot of loss of communication. So there's lots of stuff going on, and definitely going forward, the Government of Northwest Territories recognize that and has already implemented a lot of those changes and will continue to do so. Thank you, Mr. Speaker.
Minister Municipal and Community Affairs. Oral questions. Member from Mackenzie Delta.
Thank you, Mr. Speaker. When communities and organizations ask me to advocate on their behalf, I try my best to get positive results, and if there's no positive results, I ask them, for an explanation. Because if I don't get an explanation, they feel that I'm not doing my duty as their representative. My question is to the Minister of EC&E. Simple yes or no would be sufficient. Out of the 3 interested organizations from McClavic and Sigachik, were any of these organizations successful in their bid to utilize the learning centers within their respective communities? Thank you, Mr. Speaker.
Member From Mackenzie Delta, Minister of ECE.
Thank you. It's not a yes or no question because I simply don't have the information on the floor of the House without having a heads up of the question. Thank you.
Thank you, Minister of ECE. Member from Mackenzie Delta.
Thank you, Mr. Speaker. With that answer, my two other questions wouldn't be relevant, so I'll find another way of adding it. Thank you, Mr. Speaker.
Colleagues, our time is up. For oral questions, oral questions, oral questions, written questions, written questions. Returns to written questions, returns to written questions. Replies to the Commissioner's address, replies to the Commissioner's address. Petitions, petitions. Reports on committee on the review of bills, reports on committee of the review of bills. Reports on standing and special committees, reports on standing and special committees, tabling of documents, Minister of ITI. Minister of ITI.
Thank you very much, Mr. Speaker. Mr. Speaker, I wish to table the following three documents. Prosper NWT, 20 years of bringing greater prosperity to the NWT business and communities, 24-25 annual report, Prosper NWT 2025-26 corporate plan priorities and actions, and strategic plan April 2025 to March 2029, Prosper NWT. Thank you, Mr. Speaker.
Thank you, Minister of ITI. Tabling of documents, tabling of documents. Notice of motion, notice of motion, motions, motions, notice of motions for first reading of bills, notice of motions for first reading of bills, first reading of bills, first reading of bills. Second reading of bills, second reading of bills. Consideration Committee of the Whole of bills and other matters, table documents 385-20 brackets 1, table document 386-20 brackets 1, table documents 387-20 brackets 1, and table document 388-20 brackets 1 with the member from Toonaday-Willowday in the chair.
I now call the Committee of the Whole to order. What is the wish of committee? I'm going to go to the member from Nunavut Lake.
Thank you, Mr. Chair. Mr. Chair, the committee wishes to consider table document 385-20 brackets 1, 2026-2027 capital estimates, the Departments of Municipal and Community Affairs, and the Department of Health and Social Services. Thank you, Mr. Chair.
Okay, thank you. Does the committee agree? Thank you. Your committee will proceed with the first item, but before we do that, we'll take a short recess. Thank you. Okay. Committee, we have agreed to consider table documents 285-20 brackets 1, 2026-2027 capital estimates. Department of Municipal and Community Affairs. Does the Minister of Municipal and Community Affairs wish to bring witnesses into the chamber?
Thank you, Mr. Chair. I do.
Thank you. Does the committee agree? Thank you. Sergeant Arms, please escort the witnesses into the chamber. Would the Minister please introduce the witnesses?
Thank you, Mr. Chair. To my right, Deputy Minister Gary Brennan. To my right, Catherine Boyd, Director of Corporate Affairs.
Okay, thank you. The committee has agreed to forego general comments as the committee agreed to proceed to the details contained in the tabled documents. The committee, do you agree? Thank you. Committee, the Department of Municipal and Community Affairs begin on page 71. We'll defer the department totals and review the estimates by activity summary, beginning on page 72, with a community operation with information items on page 73. Are there any questions? No questions. Moving on. Department of Municipal and Community Affairs, Community Operation Infrastructure Investments, $17,280,000. Does the committee agree? Thank you. Next, we have Regional Operation on page 74 with information items on page 75. Are there any questions? No questions. Department of Municipal and Community Affairs, Regional Operation and Infrastructure Investments, $32,861,000. Does the committee agree? Thank you. Next, we have Sport and Recreation and Youth on page 76, with the information items on page 77. Are there any questions? I want to go to the member from Sauk 2.
Thank you, Mr. Chair. Capital-related facilities such as what's on this page here, sport, recreation, and youth, are part of the recreational facility in Fort Good Hope at the arena. And can the minister explain if there's any discussions going on with the finished portion of the facility to bring it back into operation? I know there's some integral questions to the structure and so on, but I also understand some work has been done and some planning has been done. So I just want a status update and if this is going to be a portion of the capital or that project as part of this capital. Thank you.
Thank you. I'll go to the minister.
Yeah, thank you, Mr. Chair. So the recreational facilities in communities are under the community governance. So they would fall under their funding that they receive in operating their recreational facilities. So more of a community operations question, but I know they have funds available within their budget to do that type of work if they so choose. Thank you, Mr. Chair.
Thank you. I'll go to the member from South 2.
Thank you, Mr. Chair. Will the minister provide me an update on the capital available to that facility? Thank you.
Thank you. I'll go to the minister.
Yeah, thank you, Mr. Chair. I can't speak directly to individual facilities in the community. However, I will share with the member their funding formula and what they have available. Thank you, Mr. Chair.
Okay, thank you. I'll go to the member from Sawtooth.
Thank you, Mr. Chair, and thanks to the Minister. I look forward to that information, and I'll go from there. Merci.
Thank you. I'll go from the member from the Decho.
Thank you, Mr. Chair. My question to the minister is what projects are scheduled for my riding, for the Decho riding, my communities in the riding? Thank you.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. Again, a lot of the community governments receive funding for their operations in their own communities. So Decho Riding has a few communities, excuse me, and they've already received, or they have a lot of their funding already allocated through their planning. So I can share that information also with the member if they like, but it's more of a community operations line of questioning that I couldn't answer for the communities. I'll also maybe just ask the Deputy Minister just to share a few things there. Thank you.
Thank you. I'll go to the Deputy Minister.
Thank you, Mr. Chair. Yeah, so just to add a couple comments to what the Minister already said is that we do provide funding to all communities, including communities in the Decho region. Our staff will work with community governments to develop a 5-year capital plan. So we do that every year, work with them in terms of making sure they understand what a capital plan is, what type of investments they want to make, and help them plan for the next 5 years. But the actual projects that are undertaken are decided on by the community government in each community. So we wouldn't, we would just give them advice on how to plan and whatnot, and they make those decisions locally. Thanks.
Thank you. I'll go to the member from Decho.
Oh, sorry, Mr. Chair, I don't have another question for that.
Okay, thank you. We're going to go on to the member from Yellowknife North.
Thank you, Mr. Chair. I just wanted to ask quite simply, so under the Sport, Recreation and Youth list, there is money for a new SUV for the lottery. Why does the Lottery Commission need an SUV? Thank you, Mr. Chair.
Thank you. I'm going to go to the minister.
Yeah, thank you, Mr. Chair. Excuse me. The sports and recreation area there, they've never really had a vehicle to operate, and I think a lot of times they're using their personal vehicles, which is not supposed to be allowed, but essentially it's for running around doing the work with the Western Canadian Lottery stuff, and also doing you know, picking up and dropping off mail for all the Nevadas and 649 stuff and delivering it throughout the community, and also bringing it to like the mail and whatever else to get out to the community. So thank you, Mr. Chair.
Thank you. I'll go to the member from Yellowknife North.
So, like, I'm trying to understand, I don't want to harp too much on this, but I'm trying to understand the process that this is the first time they've had a vehicle, and it was decided that it was an infrastructure priority, like overall in our capital plan, that the Lottery Commission needed a vehicle. I'm trying to understand what that was weighed against in terms of priorities, like what were the other possible things that we could be spending infrastructure on, and looking at some of the other areas, housing, other departments where people are really under the gun to cut off of their list like really necessary sort of maintenance to existing assets, and in education departments, schools, et cetera, did this proposal for a new vehicle for the Lotteries Commission have to like compete against anything from any of the other departments in terms of what they wanted to bring forward for new infrastructure spending? Thank you, Mr. Chair.
Thank you. I'm going to go to the minister.
Yeah, thank you, Mr. Chair. So the excuse me, the 51,000 under small capital projects for the small sport utility vehicle is more of a safety liability thing for the division for sports and rec. They have to run around, they have to do their business within the community also, and also travel around the region. But they also, like I said earlier, they also deliver Western Canadian Lotteries things to the post office, to venues across Yellowknife and the region, and yeah, get it out to the community. So not so much just a wonderful purchase of a new vehicle. It's more of a safety liability thing, and them not using their personal vehicles also. Thank you, Mr. Chair.
Thank you. I'll go to the member from Yellowknife North.
Thank you, Mr. Chair. I mean, I think I've made my point. It's obviously one small thing, but in the bigger scheme of things, I would just point out that we have lots of urgent needs that have safety and liability concerns attached to them that we continually kind of look over because there's just not enough money to repair this thing or repair the roof in the school, or the things that obviously also have major safety and liability issues attached to it. So it's not a matter of whether it's a safety or liability issue. Often we're ranking the severity of those things. So I really am hoping that going forward we can just be taking a closer look at how we rank the severity of the risks and concerns as we rank our infrastructure projects. Thank you, Mr. Chair.
Okay, thank you. I'm going to move on to the member from Monfouille.
Thank you. Thank you, Mr. Chair. Okay, first, I want to ask about this large capital projects for 26, 27, and there's nothing for small. This 17 million, I just want to ask the minister, how is this, okay, first I want to ask how much of this is allocated to Klitschko region, and what formula are they using to determine for an allocation? I mean, it would have been nice if we had more information on here, but there's nothing. It just says large capital projects, and then that's it.
Thank you. It has been posted to me that to the member from Monfouille that we're on page 70. Sorry, you were on page 72 when we're on page 76. Is there any questions on page 76 that you have? We could ask the minister. Thank you.
You pass. Okay.
On page 76.
Okay, we're on page 76. Oh, well, I think we can still go back to it.
Yeah, thank you. I'm going to go to the, we need a unanimous consent from my members on this, so I'm going to put it out to the members. Are you in agreement to go back to page 72 for the member from Monfouille? To members, do we have your agreement on that? Maison? Okay, good. All right, I'm going to go to the member from Monfouille.
Okay, thank you. So can I get an answer for that? Large capital projects. And that's for the community operations and regional operations as well, 32 million for large capital projects. It doesn't say what it's, I mean, there's no detailed information. So I would like to know how much of this is going to be going to Klitschko region.
Okay, thank you. I'm going to the minister.
Thank you, Mr. Chair. Yeah, so just so the members aware, again, all the community funding goes out to the communities, which they allocate, excuse me, through their funding or their capital planning, and we document it here as part of their as part of the large capital for the communities. But every community has their own large capital spending, which we have broken up. But if we want to go by community or region for the member or what she would like to know, yeah, we can share that. Although if you will recall, and I can do it again, but last year I sent out community fact sheets which had all that information on it with all their funds, and I can send them out again to all the members so that they have them available. But I'll actually just pass it off to Deputy Minister Gary Brennan here just to point out a couple things. Thank you, Mr. Chair.
Thank you. I'll go to the Deputy Minister.
Yeah, thank you, Mr. Chair. I think I remember the question correctly about communities in the region, but I do know that I have a listing here. It's fairly detailed. In 26, 27, $943,000 will go to the community of Betchico for 3 projects, and we have that broken down for each of the other communities if you want me to read that there. But I think the question was for Betchico. So, thank you, Mr. Chair.
Okay, thank you. I'll go to the member from Monthly.
Okay. I represent 4 communities, so I would like to get information for all 4 of them. Yeah. Thank you.
Okay, thank you. I'll probably go to the Deputy Minister on that one.
Okay, thank you, Mr. Chair. Sure. Okay, so for Gamity, and it might take me a while to plug through some of these numbers here, we have $200,000 for 2 different projects. 26.7, this is from ISIP money. These are projects that the communities applied for and were approved. I have to go through and look at the communities. Wekwedi, two projects, a total of $239,000, and Wati, 2 projects for $473,000. Thank you, Mr. Chair.
Thank you. I'm going to the member from Monthly.
Thank you. In Betchico alone, there's, thank you for the information. I do appreciate that. And then in Betchico, there's Betchico, Edzo, and Frank Channel. You know, because people have been asking about that too as well, that, you know, they need, I know it's a separate, it's all considered as one community, but it's still a distance. So, but that's up to the community government of Betchico to determine. Another one too here is that I see on page 73, Canada Housing Infrastructure Fund, and for Betchico 2930 and Wukati 2728. Can you explain to us what are these for? Canada Housing Infrastructure Fund, investing in Canada Infrastructure Program, but it has different dates on there for completion, estimate completion. Yeah, thank you.
Thank you. I'll go to the Minister.
Thank you, Mr. Chair. I could go through every community and give out every community's capital plan. This fund is divided up to the communities to fund their projects within the community. So a lot of this, like the Investing in Canada Infrastructure Program that she's speaking of, is all distributed to the communities. We don't hold on to any of that. It's all part of their capital plan and all their developing within the communities. Thank you, Mr. Chair.
Okay, thank you. I'll go to the member from Monthly.
Thank you. I wasn't asking for a list. I don't want to know everything, but I just want to know what it is. That's all I asked you. Okay, so that information was good enough, okay? And another one too, for sports, recreation, and youth for 26-27. It's a small capital projects because I know there's a cutback in that area. So what's this 51 represents capital estimates for 26-27?
Okay, what we'll do is, if we could, the member from Monthly, you could just maybe park that one for now because we'll come back to that question if we could. Is there any other questions on page 72 that you have? Thank you. No? Okay, must see. Is there any other members that have questions on page 72? I'm going to go to the member from Fern Lake. Thank you.
Thank you, Mr. Chair. Appreciate the member from Monthly asking that we went back because we were moving so quick. I missed my questions. But The first question, in this capital plan, how much is MACA budgeted to receive in ISIP funding? So the Investing in Canada Infrastructure Program, just to start.
Thank you. We'll go to the Deputy Minister. Okay.
Thank you, Mr. Chair. So for this year, we're budgeted $16,650,000 for ISIP for 26-27. Thanks.
Thank you. We'll go to the member from Frame Lake.
Excellent. Thank you very much for the quick answer. So I'm just noting that in the 2023-24 public accounts, the committee noted that MACA lapsed almost 30% of its budget during the last fiscal year. And that committee learned at the time that those lapses are largely related to carryovers from that fund, the Federal Investing in Canada Infrastructure Program. So with that in mind, I note the question I have is how will MACA ensure that funding is not lapsed and flows through efficiently to communities? So how can we ensure that the communities have the resources to spend the money that they're getting through this fund?
Okay, thank you. I'll go to the Minister.
Thank you, Mr. Chair. A lot of it relates to reporting from the communities and capacity and the timing of projects. Like sometimes communities may not be able to get them started right away. So these funds are all allocated. It's just a matter of reporting to transfer the funds to the communities and being able to, essentially being able to get them reported in order to get the funds out. It's not that the funds go away, they're spoken for, and they'll get transferred to the communities once everything's in line. Thank you, Mr. Chair.
Thank you. I'll go to the member from Frame Lake.
Okay, thank you. I appreciate that answer, and I guess I would just ask back based on that answer. I mean, what are we doing to support the communities in streamlining whatever reporting processes we need to? Just because I think the bottom line here, I think we can all agree, we want this money to get spent. This is money that's coming in from the feds. It's in the communities. We absolutely want those projects getting done. So if it's really just a reporting issue, I have a feeling there's a bit more to it than that. But can the minister just discuss how the department is providing support to communities to get this funding out the door? Thank you.
Okay, thank you. I'm going to go to the Minister.
Yeah, thanks. I'll ask the Deputy Minister to answer that for me. Thank you.
I'll go to the Deputy Minister.
Thank you, Mr. Chair. Yeah, so a couple things to add to what the minister previously said. So we do have capital planners that work with the community governments on a regular basis. So we do every year meet with them to formalize the capital planning process. But we do also try and provide support throughout the year for smaller communities in particular. We help them with project management. We help them with the competitive procurement process type things. Which can be tricky for some smaller governments for sure. And we have staff, our financial staff, that do work at the communities to try to help them get the reporting done as well. One of the challenges that we do have in communities is basically capacity. Is that we offer financial training to try and help them be able to enter things properly into the system so they can do the reporting. So we have a financial workshop annually. We also have online training for our finance folks, and we will also go to communities that are struggling to get their money spent or their reporting done, to help them try to determine what the gap is and how do we address that gap. So we do that on a regular basis with whichever communities need the assistance. There was a question as well about what are we doing to try to reduce the carryovers. One of the things that MACA used to do was front load the budgets. So we would get a budget for, let's just say, $5 million for a project. We put it in 1 year, then the community has the flexibility to spend that money as they need to, but that drives up carryovers. So now we're working with communities to try to do a better job of budgeting when they plan on delivering that project, so that our carryovers go down and they can spend the money and have the money budgeted for when they need it. If in the wonderful event that they spent over the annual allotment, then we would return to the House to get more appropriation for that amount if necessary. So. We've never seen that happen before, but we'd love to see that happen there. So that's just a few of the things that we do as a regular part of business, though. Thank you.
Thank you. I'm going to go to the member from Frame Lake.
Thank you, Mr. Chair. Yeah, the only question I would have following that then is just whether the department has a set of priorities for which, I guess, projects that are delayed by a certain amount of time and kind of ensuring that the ones that have been sitting on the list for the longest amount of time are being worked on as a priority. So does the department prioritize depending on how long a project's been sitting waiting to go? And just to ensure that we're kind of moving things off the list in an orderly manner. Thank you.
Thank you. I'm going to go to the Minister.
Thank you, Mr. Chair. With all this funding that flows through, the communities establish their priorities and the department just supports them. So the department has the staff that support the communities with all the infrastructure challenges they may have and capacity challenges. Thank you. Oh, and Deputy.
Thank you. I'll go to the Deputy Minister.
Yeah, exactly. The communities do establish priorities, but what we try to do as well is, recognize and work with communities as the timelines for the end of the agreement gets near, right? So we want them to build a project. So if we do see a particular project that is staggered or can't get going for some reason, we obviously work with them and find a rationale, but we don't prioritize it for the community. It's their decision when to do the work. But if there are challenges with contracting, local capacity, whatever the case may be, we will step in and help it as best we can. And the only time we would try to help them make it a priority, again, because they've established their own priorities, is when the funding is going to run out. In the ICIP agreement, that's 2033, so we're a ways away from that. But we want to make sure they get the projects delivered at some point in time. Yeah, thank you.
Okay, thank you. I'm going to go to the member from Frame Lake.
Okay, thank you. And that's really what I meant, was not so much that the department would be setting priorities on behalf of communities, but the department would be setting priorities for itself on where it's going to, put its resources in terms of helping communities. And my next question was going to be if there's any communities that are currently at risk of their funding lapsing, and it sounds like we've got some time, so I take some comfort there. And those are all my questions for now, Mr. Chair. Thank you.
Okay, thank you. Before I continue, is there any further questions on page 72? I'm going to go to the member from Mackenzie Delta.
Thank you, Mr. Chair. I just have one question in regards to number on page 73. I can see two of my communities in my riding there, but I don't see the community of Tsiga-Chicken is investing in Canada's infrastructure program. Can you give me some details on as to why Tsiga-Chick is not on this in this program? Thank you, Mr. Chair.
Thank you. I'm going to go to the Minister.
Thank you, Mr. Chair. A lot of this stuff, again, is related to the type of funding that they've applied for, type of projects they have going on, and what funding can be applied for it, or applied to it. And this particular funding, there is no project in the community that the community has applied for to allocate it in this pot. Thank you, Mr. Chair.
Okay, thank you. Is there any follow-up questions, from the member from Mackenzie Delta?
Yes, thank you, Mr. Chair. Can you give me some examples of what kind of programs would be under this program here, so I can look at reach out to the leadership of Tsiga-Chick and see even in the future that they do have programs that they would like to apply for. Thank you, Mr. Chair.
Thank you. I'll go to the Minister.
Thank you, Mr. Chair. And just so the members are aware, so the community already had two projects that were completed also, and this particular funding was is fully prescribed. And this funding pot is related to a lot of the roads, the solid waste facilities, water treatment plants and all that stuff. Thank you, Mr. Chair.
Okay, thank you. I'm going to go to the member from Mackenzie Delta. Is there another question? Thank you.
Thank you, Mr. Chair. Would fixing a drainage system fall under this this category? Thank you, Mr. Chair.
Okay, thank you. I'll go to the Minister.
Yeah, this program it will.
Okay, thank you. I'll go back to the member from Mackenzie Delta.
Okay, thank you, Mr. Chair. Yes, I've been receiving calls about their drainage system not being adequate enough to keep water out of their off their roads. So I'll have to make them aware that you said this year's allocation, you can see it's 27, 28, some completion dates. So I don't know, maybe they can start working on a plan where they can allocate funds for this this program to fix their drainage system. It's more a comment than a question. Thank you, Mr. Chair. That's all I have.
Thank you for that comment. I'm going to continue on. Is there any further question on page 72? I'm going to go to the member from the Decho.
Thank you, Mr. Chair. I wanted to look at actually it has to do with the Housing, Canada Housing Infrastructure Fund. I wanted to know what that is, and that is to do with MACA, is Canada Housing Infrastructure Fund. What is that, and how does that relate to community governments? Thank you.
Yeah, thank you. I'll go to the minister.
Yeah, thank you, Mr. Chair. So the CHIF funding is used for communities to apply for in projects, some big projects. We recently just signed the agreement of 74 million, and that's over a certain amount of years. So there are some there's been three big projects that have been approved for communities: Fort Smith, Fort Providence, Fort Liard. And yeah, so the communities can apply for this CHIF funding, but it's up to the community to have projects on the books and ready to go. So just trying to think. Sorry, that's good. Thanks.
Okay, thank you. I'll go back to the member from the Decho.
Thank you. Thank you, Mr. Chair. Now, Canada Housing Infrastructure Fund, that has to do with housing. What is it like? So you said does this have to do with housing? Like, can MACA apply for housing for the community governments? Thank you.
Thank you on that question. And we'll go to the minister.
Yeah, thank you. This program is designed to basically support critical infrastructure for housing. It's not actual for houses, but it's designed to like build subdivisions or waterworks and everything like that. Thank you.
Thank you. I'll go back to the member from the Decho.
Okay, so it's not to get houses for like Hamlet's, for Hamlet staff housing or anything like that. That's what I was thinking that was about. Okay, you have two of my communities on their enterprise for 27-28, and you have Fort Providence for 27-28. Can you, like the member from Mofway asked, can you tell me what those are, or what is the amount for them? Thank you.
Thank you. I'm going to go to the minister.
Yeah, again, thank you, Mr. Chair. So again, this funding is that the communities have applied for through their capital planning process. If the member wants, we can share that information now. It's community projects, not our projects. Or if not, I can share the information afterwards with their capital plan and their fact sheets.
Okay, thank you. I'll go to the member to that question.
Yeah, thank you, Mr. Chair. I would like the fact sheets. Thank you. You don't need to share it here.
Was there any further questions from the member from Decho?
Thank you, Mr. Chair. No, not at this time.
Thank you. Is there any further questions on page 72? Okay, I'm going to move on to page 76 for sport and recreation youth. I'm going to go back to the member from Montfrey. I think you had your hand up on page 70, on page 76.
Yeah, okay. Well, I want to go back to page 74.
I'm sorry, yeah, the member from Montfrey, can you repeat your question again? Let's see.
For page 74?
No, for page 76.
Okay. Okay. Can we go back to page 74?
There's a question by the member to go to page 74. I need unanimous consent from the members. Can I get the members agree to going back to page 74? Can I hear agreed? Lizzie? Okay. Thank you. We'll go back to page 74. We'll go to the member for Montfrey.
Thank you. Thank you, Mr. Chair. For regional operation, MACA, for 26-27 is 32 million. And in Cleacho region, we're growing. With the all-season road community, Wati is going to be expanding. Bichiko is expanding. We're building a subdivision. And it means that we're building subdivision, so our community, it's growing, and we're going to be needing more infrastructure, water, sewer, and we're going to be getting a new school. So we are getting ready. So with that in mind, community government is public government. But we're within the land claim, and community government is in the Cleacho agreement. So based on that information, I'm not too sure here, but I just want to ask the Minister, how are they going to be allocating this 32,000 when we have a lot of projects on the go, and our membership are growing, our community is growing, Bichiko is growing. Wati eventually is going to be, with the all-season road, they're going to be, their population is going to be going up. So I just wanted to ask how this funding, 32 million, will be allocated, especially in Bichiko alone, with a new subdivision being created. Thank you.
Okay, thank you to the member. We'll go to the minister.
Yeah, thank you, Mr. Chair. So again, this funding is all the funding that we distribute to all the communities, so all 33 communities get a part of this funding. It's distributed through the community allocation model, and every community has an opportunity for all these funds, and it's based on the formulas that we've had in place for the last little while here. We just recently went through a change of the formula. We had briefings on that and stuff. So all the funds that we have are transferred out through the community funding allocation. So it's up to the community what they do with their funds once they get it as part of their planning. But essentially, this is the funds that get transferred through to all the communities. Thank you.
Okay, thank you. I'm going to go to the member from Montfrey. Any further questions?
Okay, sometimes the fund allocated, it's not enough. We know that, it's not enough. So, so the formula, he didn't say anything, but he said the formula that they have, is it based on population and or the infrastructure? Because when you look at it in the small communities, there's not too many infrastructures in small communities. We may have a lot of people, but so we are going to be at disadvantage with infrastructures. I don't know how, I don't know what formula that he's talking about, but it would be nice if we can see that formula or, or give us a copy of the formula that they are using to distribute. Thank you.
Okay, thank you. I'm going to go to the member to that question.
Yeah, thank you, Mr. Chair. So the department has been working with the community government in regards to this formula funding, and they continue to work with the Cleacho government. So just with that, again, the formula funding is divided up between the communities based on, their infrastructure, their services they provide, assets they have and all that kind of stuff. So it's distributed through all 33 communities fairly and equitably, so that we all have the same problem of not having enough money, and we're trying to get these funds out to all the communities so that they have them based on that community allocation model. Thank you.
Okay, thank you. Is there any further questions from the member from Monfrey?
How can you say equitably? Because only small communities, we don't have a lot of infrastructures. We provide services, but we don't have a lot of service infrastructures like Wikwiti. So, but it's good. It's a good information, and I think I have an idea too of what Klitschko are doing, community government and Klitschko government. So I'll leave it there. Thank you.
Thank you. I'm going to go to, is there any other questions from members for page 74? Okay, seeing none, I'm going to continue on to page 76. Is there any questions? Okay, I'm going to go to the member for Monfrey on page 76. Thank you.
Well, this is a continuation from my previous. It's a sports and recreations, and we know there's a lot of cutbacks. And I mean, this department is going to be getting some cutbacks. This capital projects for 26, 27, I don't know what this 51 means. If the minister can, elaborate on that. Thank you.
Thank you. I'm going to go to the minister.
Yeah, thank you, Mr. Chair. So prior to the member entering the House, MLA for Yellowknife asked about this, and it was on page 77 where it shows a light-duty sport utility vehicle of $51,000. And this is designed or used for the Sports and Rec Department to have a vehicle in place because they currently don't have one. Thank you, Mr. Chair.
Okay, thank you. I'm going to go to the member from Monfrey.
Well, same to like what my colleague from Yellowknife North said. We have lots of surpluses. Why do we have to purchase a vehicle for lottery vehicles? There's lots of surplus vehicles. So 51,000 could have went somewhere else, maybe for sports and recreations that small communities are lacking. And this is just for Yellowknife only, and nothing for the region. So, and GNWT has a lot of surplus vehicle here. So why are we purchasing this $51,000 vehicle? It's not lots, but it's lots for us in small communities because we are always without, and we don't get enough. And we're always, in some cases, community members are fundraising. So that's why I'm just asking about that one. Yeah. But yeah, after that, no more question. Thank you.
Thank you. Thank you for your question from the member from Monfrey. I'll go to the minister if you, I know you already answered this earlier. Did you want to respond? Thank you.
Great comments by the member noted. Thank you, Mr. Chair.
Okay. Thank you. Is there any further questions on page 76 from members? Okay, seeing none. Department of Municipal and Community Affairs, Sport and Recreation, and Youth Infrastructure Investment, $51,000. Does the committee agree? Thank you. Members, please return now to the Department of Municipal and Community Affairs summary found on page 71. Department of Municipal Community Affairs 2026-2027 capital estimates, $50,192,000. Does the committee agree? Thank you. Committee, that concludes our consideration of the Department of Municipal Community Affairs. Thank you to the committee and thank you to the ministers. Sergeant Irons, please escort the witnesses from the chamber. Thank you. Thank you, committee. We have agreed to consider table documents 385-20 brackets 1, 2026-2027. Capital Estimates, Department of Health and Social Services. Order. Does the Minister of Health and Social Services wish to bring witnesses into the chambers?
Yes, I do, Mr. Chair.
Does the committee agree? Thank you. Sergeant Myers, please escort the witnesses into the chambers. Would the minister please introduce the witnesses?
Thank you, Mr. Chair. Joining me today, I have from the Department of Health and Social Services, I have Kristen Berg, Assistant Deputy Minister of Corporate Service and Cultural Safety. And on this side, I have Mr. Chris Clark, Director of Infrastructure Planning. Thank you, Mr. Chair.
The committee has agreed to forego general comments. Is the committee agreed to proceed to the details contained in table documents? Does the committee agree? Okay, thank you. I'm going to committee the Department of Health and Social Services beginning on page 40. We will defer the department totals and review the estimates by activity summary beginning on with Health and Social Services programs found on page 42 with information items on page 43 and 44. Are there any questions? I'm going to go to the member from Great Slave.
Thank you, Mr. Chair. So if you look at page 44, in the breakdown of the project listing, it includes the Children's Territorial Treatment Center. Can the minister please provide a substantiation and breakdown of what is going on for that project? Thank you, Mr. Chair.
Thank you. I'll go to the minister.
Thank you. So here, the Department of Health and Social Services is recommissioning the Territorial Treatment Center facility, which closed in late 2021. This project will provide cost-effective accommodation for at-risk youth. The recommissioning work includes improvements to the washrooms, water damage, mold remediation, upgrading the kitchen, purchasing new furniture, fixtures, and equipment for the bedrooms, kitchen, and living room area, and upgrading the flooring throughout the facility. The updates will ensure that the building meets current health and safety standards. Thank you, Mr. Speaker.
Thank you. I'm going to go to the member from Great Slave.
Thank you, Mr. Chair, and thank you to the minister. Can you tell me, how much that is for that line item? How much is estimated? Thank you, Mr. Chair.
Okay, thank you. I'll go to the minister.
Thank you, Mr. Chair. As these go out for tender, we do not disclose the actual amounts. Thank you, Mr. Chair.
Thank you. I'll go to the member from Great Slave.
Thank you, Mr. Chair. Are those RFPs, tenders, etc., already selected and completed, or is work underway? Thank you, Mr. Chair.
Okay, thank you. I'll go to the minister.
Thank you, Mr. Chair. That's the process that we're in right now, is that if we can pass this through the capital budget, then come springtime, we'll be able to put those out to RFP.
Okay, thank you. I'll go to the member from Great Slave.
Thank you, Mr. Chair, and thank you to the minister for that. I also, within this section, was curious if the minister it says here for the Wellness and Recovery Center on page 43 that the estimated completion is within fiscal 26-27. Are we still on the timeline for that particular asset? Thank you, Mr. Chair.
Thank you. I'll go to the minister.
Yes, we are still on track for that.
Great. Thank you. I'll go to the member from Grace Leaf.
Thank you, Mr. Chair. That's all for now. I'll cede my time. Thank you.
Thank you. Are there any further questions from members? I'm going to go to the member from Frame Lake.
Thank you, Mr. Chair. Just on the Wellness and Recovery Center, I'm just wondering, does the minister have an idea of how we're going to cover the costs for operations of that center, knowing it's a new piece of infrastructure? Do they have estimates for how much staff we might have to add, or are we going to have to add staff in order to be able to operate that facility?
Thank you. I'll go to the minister.
Thank you, Mr. Chair. Currently, sorry, I'm just trying to find this, oh, right there. Okay, so currently the Wellness and Recovery Center being built is going to replace the day shelter and the sobering center. And so the funding that we have allocated for those two facilities will be used to run the operations of this facility. Thank you, Mr. Chair.
Okay, thank you. I'm going to go back to the member from Frame Lake.
Okay. It sounds to me like we don't have, or how do I put it? So the expectation is there won't be any additional staffing needed. There won't be any additional resources needed to operate this facility based on what we know right now.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. Mr. Chair, the programming and the operations of this area, kind of through the work that we're doing, is that we're going to be working closely, I think, with housing, and they would be taking over through the homelessness file, and we would be moving back as being the health supports that are going to be needed. And so once we get this open and operational, then that collaboration between health and housing will have to continue to see what type of services and programs that are going to be needed to continue to run that program, or if there's going to need to be further. Thank you.
Okay, thank you. I'll go to the member from Frame Lake.
Thank you, Mr. Chair. That's all my questions for now.
Thank you. Next on my list I have is the member from Yellowknife North.
Thank you, Mr. Chair. I wanted to delve more into the Children's Territorial Treatment Center to understand where this is going. So my understanding is that we had a Children's Territorial Treatment Center that closed in October of 2021. It was an 8-bed facility, and that was due to the contractor we had at the time not being able to operate the facility or find enough staff or with the budget they were given. Are we talking about the same building that closed in 2021 or a different building? Thank you, Mr. Chair.
Thank you. I'm going to go to the minister.
Yes, it's the same building. Thank you, Mr. Chair.
Okay, thank you. I'll go back to the member from Yellowknife North.
Okay, thank you, Mr. Chair. So does HSS now have a contractor willing to operate the treatment center, or at what stage in the process are they going to ensure that there's an operator in place? Thank you, Mr. Chair.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. Right now, we need to get the building up and running before we could even get into conversations with moving to how we're going to operate the building. I know we need the facility, as Child and Family Services are supporting youth in different ways, and so to be able to open up this facility and come up with a plan to how we're going to operate it, either whether it's internal or through an NGO. That will come at a later date. Right now, what we're focusing on is getting the repairs done so that the building is up to code. Thank you, Mr. Chair.
Thank you. I'll go back to the member from Yellowknife North.
Okay, thank you, Mr. Chair. So that is good to know. I certainly agree with the minister that we need this service, and the closure left a big gap. We need a treatment center for minors, for children. Can the minister explain, is the plan to operate it as an 8-bed facility as it was operating before it closed, or is there like a new model of operation that would mean that the building would somehow be designed differently or offer different types of services? Or are we essentially just trying to renovate it and get it to be offering the same types of services that it was doing before it closed? Thank you, Mr. Chair.
Okay, thank you. I'm going to go to the minister.
Thank you, Mr. Chair. Right now, as it stands, it would be open to 9 beds, and we would be operating it as we did before. Thank you, Mr. Chair.
Okay, thank you. I'll go to the member from Yellowknife North.
Okay, thank you, Mr. Chair. So this is all great information to have, and I hope will be good news for the public. I secondly wanted to ask the improvements to be made to the Yellowknife Primary Care Centre. I assume that is, we're talking about the Tliwe-Guati building, but the minister can correct me if that is not correct. So I thought that it was just last year that primary care moved into that building. Can the minister explain what improvements are needed already and what, I mean, I understand we're leasing that building, so what is the responsibility of the landlord, and what exactly, you know, well, I'll just leave it there for now and come back to follow-up questions. Thank you, Mr. Chair.
That was the question? Or your comment? I'll go back to the member from Yellowknife North just to clarify that. Thank you.
Thank you, Mr. Chair. So to clarify, the first questions are we talking about the Tliwe-Guati building? Why are improvements needed so soon after they just sort of moved in and set up shop there? And what exactly are the improvements? Thank you, Mr. Chair.
Okay, thank you. I'll go to the minister.
Thank you, Mr. Chair. We are talking about the primary care center, so we're talking about downtown. Tliwe-Guati building opened up and we moved the primary care clinic downtown with primary care outpatient rehab services now in Tliwe-Guati. Other programs and services will be moved into YPCC building. We have leases scattered out throughout town, the Yellowknife, and I believe that we're trying to utilize more spaces that we minimize the amount of leases that we have, and so we need to do some renovations in order for those current spaces at the primary care, Yellowknife Primary Care Center to accommodate the different type of care that's going to be provided there. So that's what these renovations are. So.
Okay, thank you. I'm going to go back to the member from Yellowknife North.
Okay, thank you, Mr. Chair. Thanks for that clarification. I'm curious to know, and this might also apply to the Child and Family Service Program space improvements that we're making, where it looks like we're also leasing that space. So as the lessee, we're going to be paying for these improvements, but if we decide to no longer use that space in the future, to, you know, the lease ends or something, that I assume that the landlord just sort of gets to keep the improvements. Like, how does it work when we're just the lessee, but it looks like we're paying for these improvements? Or does the landlord share some responsibility for paying for some of the improvements? Thank you, Mr. Chair.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. When we lease space and we make accommodations, those accommodations are at our cost with approval from the leaser. Or the leasee, we're the leaser, sorry. And if the lease expires and we leave the facility because we have something or somewhere else to go or programs change, then those renovations just remain where they're at. Thank you, Mr. Chair.
Okay, thank you. I'll go to the member from Yellowknife North.
Thank you, Mr. Chair. So what are the improvements that we're making to the Child and Family Services program space? Thank you, Mr. Chair.
Thank you. I'll go to the minister.
Just let me find that. It's a different top. Okay, right here. So the department is going to issue, so this is the Child and Family Service needs to increase its team, but the space they're housed in doesn't allow for any expansion at the Jan Sterling building. So what we are doing is we are going to have to new location will require improvements to meet the needs of the program. The improvements will ensure accessibility and safety of all users. The new location will offer a culturally safe environment for all users. So the department has issued a request for proposal for a lease space in Yellowknife to relocate Child and Family Services, this Child and Family Service program. Thank you, Mr. Chair.
Thank you. I'll go to the member from Yellowknife North.
Thank you, Mr. Chair. So I'm a bit confused whether the money here is to improve the current space that we're in or to relocate and find a whole different space to lease for the Child and Family Services program. Can the minister clarify?
Thank you. I'll go to the minister.
Thank you, Mr. Chair. I'm going to, who wants to give the more detail? Chris? Sorry. Oh, can I pass it over to Mr. Clark? Thank you.
Yeah, thank you. I'll go to the director.
Thank you, Mr. Chair. Yes, so we are looking at amalgamating leases so that we can maximize our lease space after we moved out of to Sriwangonti. We had some less utilized leases. So for us to be able to relinquish some leases and amalgamate into less lease space, we just need to make some slight alterations to those spaces. For instance, removing the sinks from the clinical rooms at the old YPCC so that they can become counseling rooms, things to that effect, just to make the program operable and maximize its efficiency.
Okay, thank you. I'll go to the member from Yellowknife North.
Okay, that answer makes sense to me. I am all for efficiency and amalgamating spaces if it makes sense. Last question is, on the first page, there are 3 planning studies listed for different health and social services centers, one in Jean Marie, Kikiza, Sigachik. Can the minister explain what those studies are planning for? Is it to plan a new health and social services center, or to plan a better use of the existing space, or is it program planning, or what is the planning study? Thank you, Mr. Chair.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. So the planning studies, so within Kikiza, they lost their health cabin to fire. So we are doing the planning study to build them a health cabin. The Jean Marie health cabin was flooded in the very first flood I remember of the 19th Assembly, and that we had to deal with, and that minor repairs were done to it, but that facility needs to be replaced. And Sigachik's planning study, because that health center also needs to be replaced. So, thank you.
Okay, thank you. Next on my list I have is the member from Mackenzie Delta.
Sorry, the member from Yellowknife North asked my question, so it's been answered. Thank you.
Okay, thank you. Monfrey Satu Decho, the member from YK North. Okay. Next I have on my list is the member from Monfrey.
Okay, thank you. Thank you, Mr. Chair. Can I go to page 42? Or, or is it from 42 to? I don't want a unanimous consent.
We're 42, yeah.
Yeah.
43 and 44.
Okay, good, good.
You're
Okay.
good, yeah.
Okay, then, thank you, Mr. Chair. For 26, 27, large capital projects, 24, 25 was 21, and then it went up, and then 25, 26 was 44. If the minister can explain why there's a reduction for 26, 27 for large capital project? On page 42.
Okay, thank you. I'm going to go to the minister.
Sorry, just got to find the rate. So within prior years, I think we had other allocations. I think there was larger bills for, I think, Toledo and the wellness and recovery. The first big chunk, the first chunk of money that we got from the federal money that was allocated was in the 25-26 budget. And I believe the long-term care in Hay River had some money allocated in the previous year as well. That's why the budget prior was larger. Thank you, Mr. Chair.
Okay, thank you. I'm going to go back to the member from Montfouille.
Thank you. With that in mind, for the project listing on page 44, living in the small communities, we have a lot of infrastructures that are aging. In Bichico alone, there's our health center, needs, it's old, and we know that it needs a lot of upgrading. Wati Health Center as well. And Wugwiti doesn't have a health center. They don't even have a morgue or holding body. I think that's what it's called. They don't have that. And this summer, I know that when I went to Wugwiti, it was greatly needed for in the community. But yeah, so it is okay, the project listing, all this in Yelnap, it's good, I know that, everybody uses it, but I just want to know why some of these, like Bichico Health Center, it's an old, well, I mean, it needs a lot of upgrade, Wati as well, and Wugwiti doesn't have a health center. The health center that they have, it's a little small office space that's situated right in the community government building, and there's no holding morgue or holding body. I think that's what they call it. I know Gamity got one last year, so I know they were asking about that too as well. So why it's not, or is there a plan in place that the minister going to look into this in the future for Bichico, Wati, and Wugwiti? Thank you.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. Mr. Chair, I think through our infrastructure within Health and Social Service, working alongside with infrastructure, we look at all of our facilities that we currently have, and we have many. Like there's a lot of large capital, there's a lot of small capital, and we have to decide. We have to make decisions every year on what's going to be brought forward, and there are. Each health authority brings forward their needs, and then they go into a bigger pot, a decision on. So we can only bring forward so many things every year. Sometimes we can't always build new. We have to try to extend the lives of many of our buildings, and so you'll see in this budget that we're trying to extend. We're doing small capital and large capital on doing repairs to buildings, and that's kind of taken the place of some of these planning studies as well, where there is a facility can we keep it going longer by doing these studies? So I hear what the member is saying. And if she has specific things that she wants us to look into for her, I can commit to getting back to having that conversation with her, and then we can discuss that within our system to see where those are. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Montfrey.
Thank you. Thank you for the answer, and I will follow up with an email. So I will do, yeah. Well, we talked already on other stuff. So, and you know, I know I did a member statement on hospital before. You know, we used to have a hospital in Bichico. We had a hospital in Edzo, the Cottage Hospital. So I know that right now we have quite a few patients that goes from my community and from other community as well to go to Yellowknife, like for example dialysis and other treatment as well. And sometimes it's hard on people to travel back and forth, you know, go in one day and go out the same day, you know, go home the same day. So that's kind of, it's stress on some of the people that I talked to. So they did mention mini hospital with dialysis, to treat dialysis patient, to treat cancer patient. And I'm, you know, I just wanted to ask the minister if, and I did put it in my member statement before too, but if she was in contact or talked to the Klitschko leaders regarding a possible mini hospital in the near future in Klitschko region to accommodate the people, not just, it won't just be for our people, it's going to be for the surrounding area as well too. Thank you.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. Mr. Chair, no, I have not had those conversations with the leadership. However, I do communicate regularly with the TCSA, Klitschko Community Service Agency, and this discussion has not come up. We support the service that they have, as they are the lead in their jurisdiction on how these services are provided. We support them. NTHSSA supports them. And so, yeah, thank you, Mr. Chair.
Okay, thank you. I'll go to the member from Montfrey.
I just wanted her to see if she can commit to building a mini hospital in Klitschko region. But I do understand, though. Yeah. Thank you.
Thank you. Next on my list, I have a member from the Sawtoo.
Thank you, Mr. Chair. I'm confident that proper planning was taking place here when we look at the Wellness Center allowance there, capital allowance for Delaney, Fort Good Hope, and the Health and Social Services Center in Toledo, construction of level B. It tells me that these seasonal access communities, in particular the under construction building in Toledo, has allowed for some capital to purchase and spend some cost, and the transportation of those purchases over the winter road. So I just point that out to the minister, and I have every confidence that this capital will be best utilized over the upcoming winter road season for these projects. Thank you.
So I take that as a comment from the member, or is it a question to the minister? I'll go to the minister on that. Thank you.
Thank you, Mr. Chair. As for the Toledo, it's going well and it's on track, and completion date is the spring of 2026, and then operational preparedness, train, set up equipment, open the fall of 2026. I do not, at this moment, I'm not sure. I'd have to get back to the member on, if there's anything else that's going to need to go up to Toledo before that opening date. And thank you, Mr. Chair.
Yeah, thank you. Just your piece issue. But anyway, go back to the member from the Sawtooth.
Thank you, Mr. Chair. I got nothing further. Thanks for the opening of the facility targets there, Minister. That's it.
Okay, thank you. I'm going to go to the member from the Deschaux.
Thank you, Mr. Chair. And my question about the Kikisa Health Cabin. You said the one that was there burned, and so now they're going to build another one. When do you anticipate? It looks like the study's going on next year and the year after. So when do you anticipate this building to be working or built? Thank you.
Thank you for your question. I'll go to the minister.
Thank you, Mr. Chair. So how our capital process works is we look for the approval for the planning dollars. So those planning dollars will help us to create the planning will begin in 2026, producing a schematic design and a Class C cost estimate. And then once that is done, then we can anticipate, to put forward a request for after that fiscal year. And then when it does, depending on, the build, any health facilities can take any, a couple years to 3 years. I know that this is a health cabin, so it could be faster. Thank you, Mr. Chair.
Thank you. I'll go back to the member from the Deschaux.
Thank you. Will you be using local contractors to construct this building? Thank you.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. What we will be doing is we will be going to procurement process. So that is what we would be doing. We would be looking at, thank you, Mr. Chair.
Okay, thank you. I'll go to the member from the Deschaux.
Yeah, thank you. So you don't anticipate this to be ready till about 27, 28? Thank you.
Thank you. I'll go to the minister.
So we don't anticipate to have the plan until 27, 28 to go forward with. Thank you, Mr. Chair.
Thank you. I'll go to the member from the Deschaux.
Thank you. Is there any other, well, because this is 27, 26, 27, 28, is there anything for Enterprise to have a house cabin or anything like that in the future? Thank you.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. There is no plans in place for a health cabin in Enterprise, as Enterprise proximity to Hay River. Thank you, Mr. Chair.
Okay, thank you. I'll go to the member from the Deschaux.
Would there be a possibility of that happening in the future if it were requested? Thank you.
I'll go back to the member from the Deschaux. I missed the last part.
Would there be an opportunity for Enterprise if there was a request made by them or the residents for a health cabin in the future? Thank you.
Okay, thank you. I'll go to the minister.
Thank you, Mr. Chair. At this time, I could appreciate the member asking this, and that there was, you know, because of the location, close proximity to Hay River, there is nothing in our plans to do this, and therefore, within our plans, there are many priorities in our infrastructure plans to have to do over our 20-year plan, our 5-year, 20-year plan. So, so it's not at this time. Thank you.
Okay, thank you. I'm going to go to the member from the Decho.
Thank you. Okay. That's all I have for that. Thank you.
Okay, thank you. Next on my list I have is the member from Great Slave.
No, sir.
Okay. Okay, thank you. Continue on page 42. Moving down to, is there any further questions? Seeing none, Health and Social Services. Health and Social Services Program, Infrastructure Investment, $26,415,000. Does the committee agree? Thank you. Moving on to long-term continuing care services, beginning on page 45 with information items on page 46. Are there any questions? I'm going to go to the member from Inuvik-Boot Lake.
Thank you, Mr. Chair. Mr. Chair, I note in the long-term facility plans that there is a construction of a 38-bed long-term care facility in Hay River. I think that's great. Congratulate the residents of Hay River. But as I know, Mr. Chair, as the Minister knows, we do have a location in Inuvik that's had some geotechnical work done. The area has been cleared. I know the Minister likely may even have a copy of a presentation and or a design and a operations facility plan for such a facility in Inuvik. But what I don't see is it on this list this year for this year's capital plan. Can the Minister speak to what, if any, the plan is for the Inuvik long-term care facility, Mr. Chair?
Thank you. I'll go to the Minister.
Thank you, Mr. Chair. The way our process works is we allocated those funds the last budget for the planning phase. We're still in that planning phase. At this point, I think the RFP is to go out for design and schematics. There was a delay because what ended up happening is that they went and took a bigger look at the facility. I believe that because of the age of the building, it was due for midlife retrogrades, and so to be able to go forward to do all of that, because in adding on to the hospital, it's going to need to expand heating, kitchen, laundry, those types of things, and so doing it separately was, so what they've done is they've taken it all in account, and that planning, that RFP should go out before Christmas so that we can go for the schematics. Thank you.
Okay, thank you. I'll go to the member from Inuvik-Boot Lake.
Thank you, Mr. Chair, and thank you for that. So if I'm hearing correctly, then likely that is something we'd see in likely next year's capital plan, Mr. Chair.
Okay, thank you. I'm going to go to the Minister to the question.
Hopefully next year.
Okay, I'll go back to the member from Inuvik-Boot Lake.
I may have missed that, Mr. Chair. Was that a yes, or was that a hopefully, or was that a...
Okay, I'll go back to the Minister for a clearer definition.
We are going out to RFP for the schematic and designs, and if we can get that done quick, if it comes back quicker, then hopefully we can have it on the plan for next year. But I can't guarantee. Thank you, Mr. Chair.
Okay, thank you. I'll go back to the member from Inuvik-Boot Lake.
Thank you, Mr. Chair. And as they say, if you want to guarantee, buy a microwave, right? But I appreciate the answer. I think it's very positive, and I have no further questions. Thank you, Mr. Chair.
Yeah, thank you. I better buy a microwave for my writing. Okay, is there any further questions? Okay, thank you. I'm going to go on to continue on here. Healthcare social services, long-term and continuing care services, infrastructure investments, $11,239,000. Does the committee agree? Thank you. Members, please return now to the Department of Health and Social Services, a summary found on page 40. Health and Social Services capital estimates 2026-2027, $37,654,000. Does the committee agree? Okay, thank you. Committee, that concludes our consideration of the Department of Health and Social Services. Thank you, committee, and thank you, Minister and Sergeant Arms. Please escort the witnesses from the chambers. Thank you, committee. That concludes table documents for today. I want to go to the member from Nunavut Lake.
Thank you, Mr. Chair. Mr. Chair, I move the chair rise and report progress.
Okay. Thank you. There's a motion on the floor to report progress. The motion is in order and non-debatable. All those in favor? All those opposed? Motion carried. Thank you, and I will rise to report progress. Thank you.
Willity.
Yep. Mr. Speaker, your committee has been considering table documents 385-20(1). And Mr. Speaker, I move that the report of the committee of the whole be concurred with. Thank you, Mr. Speaker.
Member from Trinidad Willity. Can I have a seconder? I'm going to go with my buddy from the Date Show. All those in favor? Question has been called. I guess to the motion. There we go. Got her going. To the question. All in favor? Opposed? Abstentions? Unanimous? I didn't see it. Reports of the Committee of the Whole, reports on the Committee of the Whole, third reading of bills, orders of the day, Mr. Clerk.
Thank you, Mr. Speaker. The Accountability and Oversight Committee will meet at the Rise of House in the Eagle Room. Orders of the day for Thursday, October 23rd, 2025 at 1:30 p.m. Prayer reflection, minister statements, member statements, motions, motion 63-20, recognition or returns oral questions, recognitions of visitors in the gallery, acknowledgements, oral questions, written question, returns written questions, replies to the Commissioner's address, petitions, reports of committees on the review of bills, reports on standing and special committees, tabling of documents, notice of motions for first reading of bills, second reading of bills, consideration in committee of the whole of bills and other matters, table document 385-20(1), table document 386-20(1), table document 387-20(1), table document 388-20(1), Bill 23, Bill 24, and Bill 27, report of committee of the whole, third reading of bills, orders of the day.
Mr. Clerk, this House stands adjourned until Thursday, October 23rd, 2025 at 1:30 p.m.